Order, order. Welcome to this evidence session for the Health and Social Care Select Committee. This is our fourth session on food and weight management, and we are very happy to have with us, after a very busy Christmas period and some toing and froing on dates, but the top four major supermarkets and representatives of them here to talk to us about food affordability, food availability, as pertaining to this inquiry. So can I please start by asking you to just say who you are and what you do? Can we start with Nilani, please?
Nilani, Sritharan. I head up healthy and sustainable diets for Sainsbury's.
Thank you very much. Good morning.
Good morning. My name is Liz Fox and I am the Sustainability Director at Aldi.
Good morning. Good
morning. My name's Beth Fowler. I lead Asda's Healthy and Sustainable Choices team. I lead the team of nutritionists who run Asda's health strategy, voluntary initiatives, response to legislation like high fat, salt and sugar. And in terms of Asda, we're the third largest retailer in the UK, operations across the UK, serving about 20 million customers a week, and really proud to share the work that we're doing.
Thank you. Finally.
Hi everybody, and I'm Oonagh Turnball. I'm Head of Health and Sustainable Diets campaigns at Tesco. And my job is to work to support our millions of customers through their health journeys, and I do that by working with partners across the business and externally.
Lovely. So let's start in reverse order, just very briefly. Can you describe what are some actions that you've been taking in this space? As I say, when I say briefly, I really mean it. So sort of what are the top 2-3 things that you've been doing most recently in order to meet the needs of our wider population for healthy
yes,
diets?
Of course.
Can I start with Oonagh, please?
Yes, thank you. So at Tesco, we're really committed to health. We have been for a long time. Health is a strategic priority for us and for our business, and is owned at a board level. Our focus is really clear, actually, and our understanding of our role in health is really clear, and that's about addressing the barriers that we know our customers face when it comes to health. And they're really simple, but obviously really important. The first and foremost is affordability. Then we look at accessibility. And then thirdly, inspiration, doing all we can to inspire customers to get access to the information they need for great food.
Thank you very much.
Yep. From our perspective, we have been working on health for over 2 decades, so lots of voluntary initiatives, which I'd be happy to share more detail on. In terms of our current approach...
When you share more detail, you'll write to us.
Yeah, happy to
Fine.
do that,
Yep.
about voluntary initiatives we've implemented in the past. With regards to our current approach, we've got a health strategy embedded across our business, so key pillars of activity, similar to what Oonagh's touched on from Tesco. So product is really important, robust nutritional criteria from our own brand portfolio. Also, accessibility is key to our approach, and it's something that's really fundamental to our customers. We disproportionately serve customers who are lower socioeconomic groups, really struggling with budgets and day-to-day challenges around that. So that's key to our approach. And as part of that accessibility work, we've had a 2-year partnership with Nesta, where we've been looking at the healthiness of our sales, setting a sales-weighted health metric, and also running trials to look at opportunities to shift to healthier baskets. And then finally, again, similar to Oonagh, comms is a key part of our strategy. So lots of work ongoing. Our health target goes to 2030, so we've got activity coming up over the next 4 years to deliver that.
Thank you very much.
Yeah, so at Aldi, we are built on the principle that we want to provide access to healthy, affordable food. This has been the pillar of our strategy as a limited line discounter, and we need to ensure that we increase the healthiness of a range across our entire portfolio. We do this from our customers telling us we don't have a huge amount of data on our customers because we don't have loyalty apps. However, from the insight sessions that we do have with our customers, the key thing that they tell us is that they want us to keep it simple. And so that's what you see when you walk into an Aldi store. Is the first thing you'll see when you walk in is our fruit and veg. We offer Super 6 offers on those fruit and veg, and we've also ensured that placement is really important. So we adopted healthy tills years before the HFSS legislation came in. But as I said, price is our really key driving factor here to ensure that we have high quality of food at that low price. And we want to make that as simple to our customers as possible. And one example of where you might see that in our stores is we have a lot of a mixed case format. So you might see in the same place full fat yoghurt next to reduced fat yoghurt, but at the same price in the same place on the shelf. So our key mission is to make it as simple as possible for our customers to make the healthy choice.
Thank you very much.
Yes, at Sainsbury's, I want to start by saying we really welcome this inquiry. I think it's super important that we address the health of our nation, and obesity as part of that is something we see as a very serious issue. I also just want to make the point that it's really important that we get to a healthy food system, because that means that everyone has access to healthy and affordable food, and it's something we take very seriously. We're proud of our initiatives on health. To give you two long-standing examples, and then I'll go into a couple of specifics. We were the first to introduce colour-coded front-of-pack labelling in 2006 in the form of our Wheel of Health, if you remember that back then. And we were the first to introduce restrictions on unhealthy multi-buys in 2016, so almost a decade before they were regulated on. Specifically on a couple of issues, and I think we will probably talk through this inquiry on some others. On affordability, we know that this is especially important to our customers. We have invested in something called the Aldi price match, which is one of the most extensive on the market. We also extend to convenience stores, and over 75% of those are a healthy or better for you choice. And we've invested nearly £1 billion in that over the last 4 years. On reformulation, which we may not talk about quite so much today, but is still an important part of the puzzle. Just to give you one example of that, we've had many, many years of reformulating our products, but we focused on sugar reduction in the 5 categories that contribute most to volumes at Sainsbury's, and we've reduced sugar by over 35% since 2015, so a very significant reduction. We think that action needs to happen right across the system, and that we need to develop a positive food culture where healthy food is celebrated, and we welcome further discussion on that.
Thank you. So can I start by just understanding the importance? Now, forgive me, who said this is managed at board level? Someone said that. I've forgotten who.
I did.
You did. Thank you very much. Is that the same for all of the supermarkets? It's something that a specific standing order. So at Tesco, is that something that's looked at every board meeting? Is it once a year? How does that work in terms of the board papers?
Health is one of our sustainability KPIs. Mm-hmm. So along with our commercial KPIs, you would expect that to be managed, at the board level. We have sustainability committees which meet regularly, and absolutely, we will report back to that committee on all of our sustainability KPIs, including.
And is that you that reports back, or do you go through?
Yes, and the team that I work with.
Understood. And so in the org chart of Tesco, where do you sit compared to the top job?
So I work for a director who manages.
Which director?
The Director of Campaigns in Central Europe, and he reports into Christine Heffernan, who sits on our board.
Who sits on the board, and then that reports into the board?
No, she is at group level.
She's at group level, and she's the chair of the board? No, she just sits on the board?
Yes.
Right, so that's 4 levels, is that right? 4 levels removed from the board?
Three.
From the chairman of the board. 3 levels, okay, thank you very much. Beth, where do you sit in the org chart of the organisation, please?
In terms of our ESG strategy and where health sits within that, we have assessed materiality of issues across Asda, our business, our customers, and health is a priority in terms of our approach on ESG strategy. Mm-hmm. In terms of how the strategy is managed, we have a monthly governance forum. It's chaired by an exec member, and we have leaders from across the business on that forum, from retail operations, commercial. Okay, so this is a sort of subcommittee of the board. Is it managed? Can we just start with a simple question? Mm-hmm. Like Tesco, is health and this agenda something that regularly, in a sort of standing orders kind of way, comes back to board level at a regular occurrence? Yes or no? Can I just go down the line? Yes or no? Yes. So
yes.
Yes, through regular reformulation meetings.
Thank you. Reformulation in particular. Mm-hmm. Okay, yeah.
Yes, in terms of our healthy sales performance.
Lovely. But we will get into the wider ESG and all of that. But can you just answer my question? Where do you sit compared to the top job?
Sure. So I report into our technical quality and ESG director, who reports into our commercial SVP. So a member of the board. Again, three removed. Yeah. Go ahead.
Yes, so I look after our entire sustainability team. Health is a part of that. I then report into my group director, who reports directly into our chief commercial officer, who's on the national board.
Which group?
Yeah.
Similarly, so I report into our Director of Sustainability, and that sits within the commercial team, so Director of Commercial, who sits on the board. I also have very regular briefings with our Director of Commercial and our CEO.
Okay, so you get direct access to your CEO on this. Is that the same? Does everyone here get direct access to their CEO on a regular basis? Yes, you're saying yes, Oonagh. Do you, Beth?
From our perspective, the ESG sponsor, who's an exec member, it's their responsibility to take ESG issues to the board and to our CEO.
So no, and
Yes, with our CCO.
With your CCO,
who
so not to the
reports into the
CEO. Right, okay, who reports in. The reason why this is helpful is just as we question you, first of all, we understand you guys are not, you know, the ultimate decision makers. That's helpful for us to understand. But it's also, I think, interesting to see that there isn't a sort of direct at board level someone who's looking at this all the time, and I think that perhaps frames some of our discussions. So when you are reporting in to board level, what information is it that you're providing? When they're making their commercial decisions, they're making hiring and firing decisions, they're looking towards the future, they're looking at the world economic outlook right now, and they are also wondering if they can keep people in jobs. What information are you providing the board to make the decisions that they need to make? Can we start with Nilani, please?
Sure. We actually have very regular conversations on health. It's something our CEO is particularly passionate about. He actually sits on the Food Strategy Advisory Board, which is looking at health amongst other sustainability-related issues. Some of the things we particularly talk about are even things like the Healthy Start voucher and how we can help support with private sector top-ups of those vouchers. Those are benefits for the most vulnerable in society, and he's very keen to use his role to help unlock that with government.
So when you say he's passionate, has that filtered into specific KPIs, strategies? How is that? I mean, other than speaking warmly about it, has that translated into concrete changes?
We have undertaken a number of initiatives where we topped up those vouchers.
And that was led by the CEO?
That was led by the business, but actually he saw how successful that was, and he's trying to champion that now at a sector level, so that it's not just a Sainsbury's thing, but actually something we do across retail.
Very helpful. Liz, how about you?
Yes.
So the question was, what information are you providing to the board so that they can make the right decisions in and amongst all the other decisions they need to make?
Yeah, so we have obviously the specialist nutritionist within our team, and aldi is, it's our important factor from aldi is that we want to ensure that we have access to healthy, affordable food. That is built into the quality of our products, and therefore a key pillar of our strategy that we would want to move forward with to ensure that we give that offering to our customers. So the way that we do that is through regular reformulation, making sure that we have clear labelling on pack. But as I mentioned on the reformulation, that is a key driver of how we then drive positive reformulation in our products. And what I mean by that is removing salt, sugar, calories, and putting in positive nutrients like fibre as an example. All of those reformulations are overseen by either our CCO or the CEO. Mm-hmm. So the buyers will present those reformulations to our board, and then my team will help in delivering on the reporting of how we are making progress against those targets. One way we do that, one way the board that has supported us now, yes, my team has suggested it, but they have backed it, is the introduction of our Live Healthy logo to make that decision even easier for customers. And they also ask us to provide regular updates on our healthy sales target of achieving that of 85% by the end of 2027.
Okay, so you've got, I was going to come to this, and actually if you could weave it into your answers, and I was going to ask you as well, Nilani, this healthy sales target, so that is by tonnage, is that correct? Is that how you're measuring it? So you have a target, say that one more time, so it's 85%
85% of our sales by the end of 2027 need to come from healthy products, and we're currently at 81% as of the end of 2024.
Yeah. That's quite, it's 80. So do we feel that those 4% are really stretch? Why do you, that doesn't feel very much like a stretch target?
We feel that we're making good progress in those areas, but it will require continued focus by my team and the buying teams to ensure that we meet that target.
Lovely. Can I just come back to you? Have you got healthy by tonnage percentage target? What is it?
Yes, so we're currently at 81.9% healthy sales by tonnage, and we have an ambition to hit 85% by the end of this financial year. What we've found is that it has been very challenging to continue to grow that. We've seen growth, we've also seen declines, largely driven by a number of external factors. So things went in our favour when there was the Thames water contamination issue. It meant we sold more bottled water, and that favoured our healthy sales. Equally, if it's a particularly hot year, you may sell a lot more ice cream, and that can negatively impact at high volumes. Nevertheless, we have invested a lot in trying to do the right thing, and we've actually grown fruit and veg sales above market for the last 3 years. So what it shows is that it's actually quite a challenge to hit a specific target, but at least we're giving that visibility to our board.
I think we would well understand that.
Yeah,
not all of it's in your control.
Yes,
but,
totally. Yeah, but we do
so
have a target.
85%. That's okay. So again, information going to the board, and if you could also add in, do you have a healthy a proportion by tonnage of healthy sales target, and what is it now?
Sure. So we provide information to the monthly ESG steerco, led by the exec member that we referenced earlier. And a key part of that update is updates to our ESG metrics. One of those metrics is our healthy sales metric. I'll give you a bit more detail on that in a moment. The other information we share with the ESG steerco is risks, opportunities, where we're seeing, to Nilani's point, positive trends around health, where we're seeing negative trends, to try and advise the business in terms of next steps. We also have a working group that sits underneath that steerco to deliver the change, which is at director level. In terms of our healthy sales metric, that is a sales weighted average nutrient profiling model metric. We set that as part of our 2-year partnership with Nesta. So we worked with them over 2 years to share our data, help ratify that we were setting the right level of ambition, and also to look at, balancing social impact, and they looked at an independent assessment of that, as well as feasibility, commercial risks, etc., attached to that target. And I suppose the sales weighted average MPM for information includes the nutrient profiling model of the product, so how healthy is that product based on the definition the government has set, the weight of the product, which we think is really important, because if you sell a single chocolate bar, for example, that weighs, 50 grams, we would want to count...
You don't do it by tonnage in the sort of simpler way?
Weight is incorporated into the measure, and again, it's been independently ratified by Nesta. The reason that we incorporate that weight metric is because we would want to count a 16-pack of chocolate as more impactful to the healthiness or less healthiness of the basket versus a single.
You've got a weighted system. So what?
And it's weighted also by sales volume. So that's the number of products that customers buy.
You can't give me a comparable number to before.
I can give you a baseline and the progress that we've made and published. We publish that every year in our ESG report. Our baseline was 1.83 on the sales weighted average MPM, and we're currently sat at 1.77, and we will be publishing end of year 2025. We're just analysing that data at the moment.
Thank you very much. And
so for Tesco, we've been reporting our healthy sales metrics since 2021. That's when we set our healthy sales target. At that time, we had a figure of 58%. That was our baseline. And we set ourselves a really stretching target of 65% by the end of 2025. And I'm actually really pleased to say that we hit that target. It was a really stretching target. We, at the time in 2021, wasn't sure that we would be able to get there. But through a huge amount of work across our business, with our suppliers, and through all of our commercial teams, we were able to get there, as I said, by the end of 2025.
Okay. Do you have a forward target?
So now we know our focus very much, and hopefully you'll be aware of this, but we can come on to talk about it, is on reporting. What we've learned is to get to the data that we need for really accurate reporting based on MPM takes a huge amount of time and a huge amount of effort, not just for us within our business, because clearly we're keen to invest in that, but across all of our supply base as well. So our focus now is very much on looking at what reports and what data is needed, and we would ask very much actually that that's the focus for this committee, along with a standardised metric.
So the nutrient profile model in particular?
So we use, for our healthy sales target, we use the 2004 MPM score, which has been really, really helpful. As you'll be aware, obviously endorsed by government, and something that is shared across all of our supplier base. So, to be able to work with the standard metric it's hugely important, enabling us obviously to compare data year on year.
Can I take it as read, Liz and Nilani, you're using the NPN model as the basis?
We don't.
I noticed that water is included. That feels like a...
So most of us report on food and total sales and food and soft drink included together currently. That was the ambition at the time. I think there's definitely an acceptance that probably needs to change as we look ahead to mandatory reporting. And as I said, we've learned from that. We don't use the NPM as the measure today, but we do report using the NPM as well. So we developed our own internal system to help identify the better for you and healthier choice by category, linked to things like traffic light labelling and Public Health England reformulation targets. But we do also report in a way that allows comparison to others through our report. So we have one of the most extensive disclosures on healthy sales, which is available annually through our sustainability report.
What I'm getting from this is that everyone's doing it ever so slightly differently, and what we would love to be able to do, not just with you're the top four and therefore have the largest market penetration, but obviously other supermarkets are available, and it's hard for us to be able to compare and therefore judge whether these policies are going to work or not. What would be really helpful to me, if you'd be willing, is after this meeting, could you write to the committee with the specifics of how do you measure, what exactly do you do, and in the thesis question is, what is the board looking at, and then what are you guys looking at in order to make your recommendations to the board? It sounds like everyone's in a slightly different place on this, and we just don't have time to go into the detail that we would need to understand it fully. I have a feeling that this might be important. Can I pass now, please, to Dr. Becky Cooper?
Yeah, thank you, Chair. And I'm going to continue actually a little bit with this line of questioning. So, as the Chair said, you all do things slightly different, and obviously you're competitors, but you all have made the commitment today that, improving people's access to affordable, healthy food is the goal of your supermarkets. So the various health initiatives that you have done, on the basis of the data that you have collected, what evidence do you have that particular initiatives have worked and what haven't? So perhaps if we go down the line quickly and you can tell us, based on data, evidence only, what worked, what doesn't.
Want me to go first?
Go, yeah, absolutely.
So at Sainsbury's we have some of the most extensive test and learns that we have published externally, so nearly 12 since 2017. Let me give you two examples of things that worked, two where things didn't quite happen as we would have expected. What has worked is a promotion we did on fruit and veg, so pricing, reducing the price of 11 fruit and veg to 60p. I think we ran it in 2022. We saw a 78% uplift in fruit and veg sales during the promotional period on at least 9 of those 11 that were in there.
And have you continued that, or did you just have it as a promotion and then it went back afterwards?
So we continue to include a lot of fruit and veg in our Aldi price match campaign, and you may have seen that just yesterday we launched our half-price nectar stunt, which features quite a number of fruit and veg. So
okay, so if you've got a nectar card, then you can get the reductions in healthy food. If you don't have a nectar card, it's more problematic. Even
if you didn't, which actually the vast majority of customers now do, but if you didn't, the Aldi price match applies to a high number of fruit and vegetables and is included in convenience stores too.
So there's price elasticity, that works, go.
The second is our fruit and veg challenge, which we've done through Nectar, where we incentivise and we use gamification to reward customers. They're personalised to them for adding more fruit and veg to the basket. We've seen that that has led to 780,000 customers joining that scheme and 113 million extra fruit and veg being purchased.
Gamification, basically rewarding people for making healthy choices.
Yes,
okay.
Exactly.
And if you just give me one example of something that didn't work.
Yeah, sure, no problem. Pricing also didn't work when we included fibre-rich products into the Aldi price match scheme. We included whole wheat pasta and brown rice in there. We expected to see customers more tempted to try them. Unfortunately, what we saw was existing high fibre customers switched into the lines that were in Aldi price match, but we didn't see more customers willing to try those products.
And do you have any insight as to why that might be the case?
I think price alone may not be the barrier to trying those products. I don't have the answers, but I suspect it's more than just price.
Something around food preparation, perhaps?
Perhaps, yes.
Fine. Okay, thank you. That's really interesting. Is there anything else to add from your end?
So from an Aldi perspective, obviously data is limited from a customer insight specific point of view. That said, we are very, very clear that our customers want to keep it simple for them, and this is why we have moved fruit and veg to the front.
And when you say simple, you mean they want to come into the supermarket and it's very clear what's on offer and they can pick it up?
They'd like us to make the healthy choices for them as easy as possible.
Fine.
which is why we have fruit and veg at the front of the store, and we know that Super 6 is a big driver of footfall for us into our stores, and so we know that customers want to have access to healthy food at a good price. Other initiatives that we know have been received really, really well is, whilst we're obviously having that access to healthy, affordable food in store, from a wider perspective, we've also got our Get Set to Eat Fresh programme. Okay. So this is through our sponsorship of the British Olympic Foundation, okay, and it's managed to reach over 3 million children.
That's great advertising for you as well. Anything that hasn't worked particularly well?
What we haven't seen work well, and why we haven't introduced it for us at Aldi, is a loyalty app. And we don't see how that's adding confusion or to our customers that they don't want. We don't offer promotions in store, buy one get one frees, for example. It is simple pricing. You walk into the store, there's a level of equality when you walk into the store. That as you walk in, you know that you've got the same price to everybody else that's in there, and it will be at the lowest possible price for you.
Thank you. Beth, very quickly, anything that has worked or hasn't worked in your area?
We think this is a really important question. Customer behaviour is complicated, and we see various behaviours across different categories. And I think for us, the ask is for policy to be outcomes-based and allow us to prescribe the routes to deliver that change. Certainly, we're in a really similar position to others in that we have trialled initiatives over previous years, and we've collaborated with the IGD, with Nesta, Leeds University, etc.
So anything that has worked or anything that hasn't worked?
Yes, independently analyse those results, and we try to publish those results so that they're available for learning and for others to kind of access the learnings of what we've done. In terms of what hasn't worked and what has worked, it's a really good question in that, you know, we have trialled similar initiatives in different categories or in different ways, and we see different results. And this is where, again, as you know, the custodian of our customer and understanding their behaviour, we feel
amazing, Beth. What has worked and what hasn't worked? I hear you.
Fair. So in terms of results of trials, if we've talked to merchandising, so the way that we position products in our stores, we did a trial with the IGD, for example, on meat free, and we were looking at driving healthy and sustainable choices across meat. And what we saw in the academia was that if we move products in a certain way, we could achieve behaviour change. Mm-hmm. When we actually did that in store, we saw a significant reduction in the sales that we were trying to drive. So I think, again, it talks to that customer behaviour being very specific to the category and the way that they shop our stores. Signposting is another example where, the same intervention on messaging health within one category, we've seen very different results. So,
Beth, is it fair to say, I mean, obviously you have a lot of data and you've just sort of given us a very impressive sort of way of working with academia. Is it fair to say that you would acknowledge that the way your supermarket's set up would very much influence how your customers shop and their health choices or otherwise?
We think there are lots of levers that we can pull to drive.
And the setup of the supermarket, you would say, is what? I mean, there is evidence that is true. Would you agree with that?
I would agree with the levers that we can pull as a business to drive behaviour change. What I would say is if we look at HFSS legislation, for example, really complex, really costly for us to implement. When we have worked together across retail to analyse that independently through Leeds University, there's very minimal reduction in sales. So I think we're going to come to HFS later. Yes, thank you. Oonagh, anything to add?
Yeah, we're really clear. I mentioned at the beginning the barriers that our customers face when it comes to healthy food. So our focus is absolutely introducing initiatives and continuing to initiatives that address each of those barriers. So if I can give you an example for affordability, accessibility and inspiration. So from an affordability perspective, we all know cost of living is the most important thing. So our focus absolutely as a business is to ensure that for price, we are absolutely competitive on healthy lines. And a good example of that is our Aldi price match scheme, where we commit day in, day out to have all of those lines, 2/3 of those lines of 650 lines as healthy. That has been really successful for us. Okay. In addition to that, top card pricing, again, a really important mechanic. From an accessibility point of view, reformulation, others have talked about, is a really important lever. If I could use an example, which I know has been mentioned by others on this committee before, the children's yogurts category. Over the last year, we've worked really hard to take sugar out of that really important category for young people, and so much so that we've removed 16 tonnes of sugar from that category. We're now a market leader, and we will continue to move forward on reformulation. And then the final area, inspiration. As you can imagine, we continually are looking to see how we can inspire customers through all of our customer channels. So that's Tesco Magazine, which is the biggest consumer magazine, through our app, through what we do in stores, as you mentioned. And a recent example there would be our 5 a day campaign, which we launched last August. We are very aware, as many of you will be, that not enough people at all get access to their 5 a day across the UK, and indeed only 1 in 10 children. What we wanted to do was change that, and we still do. So we launched an always on campaign through all of our comms channels, and that has been really successful. At the end of that campaign, the first run in August, 42% of the basket focused on fruit and
I'm
vegetables.
so sorry, we're running short on time, and I would just like to say for the record that 5 a day is the minimum, and we really should be aiming for a lot more than that, but thank you so much. So just as very quickly, it's really interesting to hear, obviously you're doing lots of different health initiatives. Obviously they're very good marketing initiatives as well, let's not be naive about that. But we do want to obviously sort of marry those two things together. So in terms of government support, as the chair pointed out, you're all doing slightly different things. You're all competitors. Regulation to basically level the playing field, whereby you're competitors in other things, but you're not competitors in sort of the healthy food area, whereby you've all got to hit certain standards. So you're all starting from the same place. Would you be supportive of that? Just yes or no? So if we start with Oonagh.
Well, we're really
just yes or no.
Yes or no.
No, but I think it's
Yeah.
really complicated actually, because we are a really big supporter of evidence-based regulation and policy.
Okay, so it's yes if it's evidence-based, basically.
And if it's developed with implementation in mind. So
Okay, so it's a provisional yes. Beth, yes or no?
Supportive of evidence-based measures, supportive of mandatory reporting.
Okay.
But I think HFSS has shown us that evidence needs to be well-based. We're able to implement it.
Absolutely. I'm all for evidence-based regulation. I'm just saying regulation across all of you would essentially level the playing field. Liz?
Yes, supportive of mandatory reporting. We'd want to build on existing data so that we don't invest time in bureaucracy, where we can be investing that in areas where we know we can win.
Excellent. Nilani?
Supportive of mandatory reporting, supportive of better enforcement of existing regulation, and supportive of regulation that does affect the whole of the system, so levels the playing field.
Great, excellent. Level the playing field, so that's
We're going to come back to all of these points.
Right, good morning all. Right, my area, let me start by saying between 1993 and 2022, the proportion of adults living with obesity rose from 14.9%, I'm setting the scene, to 28.9%. Then it says the proportion who either were overweight or living with obesity rose from 52.9% to 63.9%. With that in mind, it has been suggested that voluntary initiatives have failed, right, to reduce the rates of obesity, and that we should be looking at more mandatory policies. What are your views? Let's start with you, Naila.
Sure. So some of the voluntary mechanisms have worked. So reformulation, there has actually, we've certainly reformulated quite a great number of products, and we would wish that there was better data to show that. However, we would support mandatory reporting, as I said earlier. Where regulation has come in, we would support better enforcement of that. So the HFSS placement regulations are a good example of where better enforcement is needed, and we recognise that. We support and actually voluntarily introduced the HFSS advertising regulations that we voluntarily brought in October, was regulated on just in January of this year. But as I said, I think looking ahead, mandatory reporting, exactly as you've just described, which would lead to one metric being used across the whole of the sector, requires us to have automated data to be able to report against that, will give the visibility and allow us to evaluate policy better to inform future policy outcomes.
You do think we should move towards mandatory rather than
I think where it's
voluntary?
evidence-based and where it levels the playing field, that can be very helpful.
Thank you, Liz. Please be more succinct.
Sorry.
Please.
Understood. Voluntary reporting has a place, certainly, but in a competitive market, it drives little incentives for progressive companies to go further. So that's why Aldi does support mandatory reporting, given all of those considerations that we've already discussed.
Right, thank you. And yourself, Beth?
Yeah, from our perspective, I do want to say that most or a lot of progress that has been made to date has been voluntary, and as a sector we have always worked proactively on this, so I do want to call that out. And you know, you've heard from us today around healthy sales metrics, and we've set those on a voluntary basis. In terms of policy, mandatory policy, again, we're supportive of mandatory reporting around healthy sales. I think to the points that have been mentioned, outcomes-based is key for us, and we feel it's important that prescriptive measures are not introduced by government, because we understand customers and our businesses and the efficiencies required to deliver low-cost shopping, which to the points raised around incomes and the pressures on cost of living is really important. Evaluation is key. I think Nilani's touched on that.
I need you to get to the point.
Two more points, I promise.
Yeah, because you're just reading from a list. Just answer the question, please.
I really do genuinely believe in this, and I care about our customers.
No, but we've got limited time, so let's get to it.
Who again are at the lower end of that socioeconomic scale. For us, final 2 points: pragmatism, and we have really
pragmatism. And what's the final point?
Our final point is a whole systems approach. So,
whole systems approach. Thank you very much. Over to yourself.
So along with others, we also support mandatory reporting, so much so that back in May, our CEO, along with the CEO of our health charity partners, British Heart Foundation, Cancer Research UK, Diabetes UK, put an ask into government for that, and we're really pleased that that's being looked at really seriously now, and we very much welcome that. So that for us is the focus, very much so as we move forward. But in addition to that, we also think there is a role for voluntary reporting and voluntary initiatives as well.
I'll let you stop there. I'm gonna go back to you now. You talked. You were the only one to talk about enforcement. Mm-hmm. Can I ask you why have you highlighted this?
We know it. For good regulation to exist, it's not just about mandating it; it's about it also being enforced. If it isn't enforced, then there isn't a sense that there is an actual regulation there. And we've spent so much money investing in implementing this regulation. We want it to be a fair and level playing field, and that's why enforcement is so important there.
Fantastic. But now we talked about voluntary. Do you think we've got to the end of what we can do re voluntary measures? Yes or no? Is there more we can do?
I think there's always more we can do, but I think the mandatory reporting will actually unlock a lot more insight. So
you think we've got to as far as we can get to with voluntary people doing things voluntarily?
No, I don't think that's fair.
No, so you don't think we've got to the end. What about yourself, Liz? Do you think we've got to the end regarding voluntary reporting?
I think mandatory reporting can, if done in the right way, can encourage more voluntary reporting.
Right. I like that. Okay, and over to yourself, Beth.
No, we think we can definitely go further in terms of voluntary measures, and by definition our healthy sales target is for the future for 2030, so there's more work to be done.
Brilliant. And
we absolutely think there is always more that we can all do to accelerate the change that's needed.
Right. My final question is, do you feel the government should concentrate more on mandatory reporting than it currently does? And where do you think that would place your organisations? I'm going to start with yourself. Is it Ola?
It's Oonagh.
Oonagh. Thank you.
Yeah.
Oonagh.
Thank you for asking. We, as I mentioned, are a big supporter of mandatory reporting, so much so as I talked about, we asked for it last year, and we would absolutely ask that is the focus as we move forward from a policy perspective, along with a standardised metric to allow us to be able to compare like with like across industry.
Brilliant. Beth?
Yeah, we're supportive of healthy sales metrics and reporting, so we would welcome more focus from government on the policy.
Thank you. And yourself, Liz?
Aldi does agree that we need to focus on simple reporting measures, building on existing data to ensure that we increase access to healthy products and clarity for customers rather than narrowing range, which links into the new nutrient profiling model discussion that we'll probably have later.
And finally, Nina.
Yes, supportive of mandatory reporting. I think we just need to get, as you've seen from here, most retailers are already reporting, so it's a question of adjusting to a common metric. In fact, the vast majority of the sector is not reporting, and I think that's where we need to see progress being made.
And I've realised I've got another minute or so. Okay. So this is a personal thing that I am passionate about. At Christmas, for the first time ever, I saw the retailers seem to come together, and the fruit and vegetables that you would have on your Christmas table, most retailers were selling it for 5p. Some went up a little bit further, but it was around 5 to 15p. How often do you come together and do this type of work? Because I do think if the retailers worked closer together to do some of this work, it would really help, because people were ringing people in my constituency to say, at that shop, it's 5p, and it's the same at the other. Do you know what I mean? It really caused a buzz at Christmas with fruit and veg. So I'm going to start with yourself, Beth.
So really pleased with your feedback on that. I think, again, price is important to all of our customers, and it's a really important initiative, and it has been running for many years. We do deep discounts at Christmas on produce to help customers manage that Christmas shop. In terms of coming together and working together, we have done that for many years. So we meet with each other, I'd say monthly, on pre-competitive issues around health, sustainability, etc. And yeah, we're committed to continue doing that.
Thank you. Liz?
I think we do need to be careful around how we talk together on price from a competitive perspective. Just highlighting that there. So I do just want to just be careful around that topic. But what Aldi is really proud of is it does set the benchmark for that low price. And as a competitive industry, obviously that's something that we're always monitoring what each other is doing. And on those promotions, I do just want to make it clear, we ensure that the temporary nature of those promotions is made clear to our customers. We also absorb 100% of that cost of those promotions to protect our suppliers. So that is a big investment from our perspective at Aldi, but we would continue to do that throughout the year on our Super 6 promotions to ensure that we can give that accessibility to our customers.
Naila?
As Liz rightly said, we don't talk about pricing between us. But nevertheless, we do invest in making healthy choices more affordable through our Aldi Price Match campaign. I will say, though, that a point that may be still relevant is that often on issues like health, whilst we do talk about things in pre-competitive areas, it's not always easy to test and learn collectively because of the issues of anti-competitiveness. So I think that is worth a conversation on how could you unlock that to make it easier to run trials across the high street.
It's a fantastic place to stop, and I'll hand back to the chair. Did I miss anybody? Did I not ask? Oh my God, I apologise.
Don't worry. Sat at the end
sorry. I'll ask.
Not at all. Well, I mean, just to sum up what others have said as well, two things matter to our customers at the moment. Health is one of them, cost of living and price is the other. So yeah, absolutely, as with others, Christmas and pricing of fruit and veg at Christmas is really important. But to us, actually, it's important all year round.
Yeah.
Josh Fenton.
Thank you. Oonagh set me up perfectly for my questions, because my question is going to be on the difference in prices between essentially the healthy foods and the non-healthy foods. So I'm going to start with Beth. Can you explain the differences in profitability between high fat, sugar and salt foods and foods like fruit and vegetables, and what the drivers of those differences are?
Yeah, thank you for starting with us, because I think to bring it back to the Asda customer, cost is really important. I've spoken about lower socioeconomic groups. It's something that we care about, and we've been collecting 15 years worth of data on our customers' incomes and the pressures on those incomes. And we know that our least well-off customers are £73 deficit each week after covering essential spend. So affordability, etc., is really important when it comes to health and more broadly. In terms of profitability, which was your question, we don't see systemic differences across healthy and less healthy categories when we look at margin data. Profitability is not driven by the healthiness or less healthiness of the product. I suppose drivers of cost are complicated, they're category and product specific, labour, raw materials, storage, perishability, etc. And we see cost pressures across our supply chain and across categories. So fruit and vegetables, we've got certain challenges around climate, for example. Brexit has introduced significant challenges in that space, but equally commodity price surges in cocoa have had detrimental impacts in less healthy categories. So we see examples of cost pressures across the piece, and profitability isn't sort of one-dimensional.
Okay, I mean, that's kind of interesting to me, because obviously the assumption is that the processed foods are perhaps a little more profitable, and that's the basis of the price, because there is a price differential and a difference in the kind of price per calorie. Can I ask you, Liz, what's driving that then? If the kind of price per calorie difference between healthy choices and non-healthy choices, if it's not profitability?
I would need to look into the specific modelling, but from my perspective, from what I do know, if we're looking at it from a calorie basis, then you could be looking, it takes a huge amount more of weight to have the same number of calories of a potato, for example, to a chocolate bar. So that may be what's driving that comparison. Similar to what Beth has said, our profitability strategy is not based on how we price healthy versus unhealthy products. Our strategy as Aldi is to have an everyday low price, and we will do that to the best of our ability for our customer.
So Nilani, Sainsbury's obviously, all of these conversations are about kind of people's income, but then also the kind of profitability question. Sainsbury's has quite a lot of local stores. Some research by Which recently found that sort of cheaper staples like pasta and vegetables and tinned tomatoes were 87% less likely to be in the local stores. Why is that?
So actually, we've done some research into this. I can tell you that the number of convenience stores we have across our estate are equally located in areas of low affluence as well as areas of higher affluence. So they are no more represented in the lower affluent areas. We also undertook a review of value, and our Aldi Price Match campaign has been extended to convenience stores as well. So you can actually get quite a large selection of items to be able to prepare up to 30 recipes from a convenience store, meaning that you would not be you can still access great value in those stores.
So you're saying convenience stores are in poorer and better off areas?
Both equally.
Yeah. I mean, that's true, but the availability of transport isn't, and that's the problem, which is why 2/3 of people on lower incomes are likely to use convenience stores once a week. So there is a problem, and there is a kind of with what's available in the lower stores. You're telling me that you've got more than perhaps Which has found. Is that something that you've found as well, Oonagh?
Well, we work really hard actually to make sure that across our whole store format, so whatever size store that you shop in, that customers are able to have access to the food that they need day in, day out, those everyday essentials that you mentioned. And we would absolutely believe that you would be able to go into any Tesco store and get any of those items at a great price. We aim to be competitive all of the time, and clearly we don't want any of our customers to have to pay more anywhere to access the food that they need to have a healthy and sustainable diet.
Then I'll hand back to the chair.
Thank you very much. I have a quick follow-up, if I may. I was really intrigued by that sort of price per calorie conversation. Do you guys have a price per calorie for your HSFF compliant food? And can we get it? Nilani, do you have it? Can you write to us with it?
We could calculate it. I think the question is, though, whether that's actually helpful, because the customer is buying a portion rather than per calorie. So I think we also need to think about that. But we could calculate it, yes.
Yeah, if it's possible, and then write to us with it, versus, because what we're trying to get to is the price per calorie for this category that is currently regulated versus everything else. That's what I'd love to see. There are others who have done this work. I'm curious to know if you've got it. Clearly you don't have it to hand, which suggests you're using other metrics, which is also interesting. Liz, do you have it?
If we have that data, we can share it. I'd need to understand how we'd be able to get that data from our systems.
Thank you. Beth, do you have it?
Just to build on Nilani's point, we don't feel that is the right metric,
Okay.
and we understand that NGOs and academics use that metric, but can I just bring it to life with an example? It's very one-dimensional. Again, look at health. Calories is a measure of the healthiness of a product, but products have nutritional profiles that span, multiple nutrients. And if you were equally to look at price per fibre or price per vitamin A, fruit and veg would look really affordable, and chocolate would look not. So I think we have concerns and challenges around that metric. what I'd like to reassure you of is it's something that we've looked at. So in our healthiest products in our range, the products with the lowest NPM scores, the price is lower of those products versus the least healthy products in our range. And we'd be happy to share more data on that.
Thank you. Yes, please. And do you have...
So for us in this incredibly complicated world, we've been very focused on the NPM model and our 65% healthy sales target, and that's absolutely what we've been
That's
looking
the
at.
North Star metric rather than this one. Okay, thank you very much appreciated. Ben Coleman.
Thank you very much. Thank you all for coming. I'd just like to focus a little bit more on the affordability of healthy food. The government has obviously the Healthy Start scheme to support pregnant women, low-income families with small children. And Sainsbury's, you were offering a £2 extra top-up at one point. Have you stopped doing that?
We offer a benefit to customers we think may benefit from it, but we are not able to assign it to the Healthy Start voucher customer. Because when the voucher was digitised and it moved to a MasterCard format, we have no way of easily identifying that customer in our systems to anonymously then generate a coupon or till. It's something we've raised with government.
Moved back to being paper-based, you still offer £2 top-up.
Yes.
Can I ask the others of you, what's your relationship to Healthy Start? Do you take the vouchers? Do you offer top-ups? Would you offer top-ups if it was a paper-based voucher? Take Tesco's, for example.
Yes, so we are really pleased to support and obviously accept the Healthy Start voucher in all of our stores and Best Start in Scotland. We actually worked with the Marcus Rashford Task Force during COVID and other actually representatives you've had on the committee, including the Food Foundation, to look at a top-up, and we were able to offer that, which was really good. Similar to Nilani, actually.
What did you offer?
£1.
And when did that run?
And that was during COVID.
We still have a cost of living crisis.
Absolutely.
We have an affordability crisis.
Unfortunately, as Nilani said, the scheme changed, but we're actively involved in conversations now with industry bodies to see what is possible.
So if it came back as a voucher-based scheme, would you still offer the £1 top-up?
Well, absolutely. We are absolutely focused on making sure that those customers who need support get the support.
If it came back as a voucher-based, you'd offer the £1 top-up.
Well, I think it's a hypothetical question because
it is a hypothetical question. It's exactly what it is. It's if it came back as a £1.
We're really a proud supporter of the Healthy Start scheme.
So what would that mean? How could it be better then for you? How could you do more? How could you contribute more towards it if it was if the scheme was reformulated, to use a
Well, Healthy Start is one of, as others have talked about, many
I'm talking
schemes
about Healthy Start.
Are...
How you would support that if it was easier to do and not electronic.
One of the big things with Healthy Start, actually, for us, and certainly during the COVID experience we had, was our role in helping with awareness of the scheme. You'll probably be aware that awareness of the scheme is low, and we do know from our partners like the Food Foundation that a lot of work needs to take place to make sure that the people who are able to access the scheme get the scheme. So I think a big focus for us, actually, a call across all of our businesses, is to help with awareness raising.
So Sainsbury's has said if it goes paper-based, they'll do a £2 top-up, and you said, don't know. What about you, Beth?
Yeah, so from our perspective, we support any scheme that supports deprived customers. That's our customer group.
Would you do a top-up if it was a voucher?
Care about those customers. I think to Nilani's point and Oonagh's point around the scheme moving to a prepaid debit card, our concern currently with
my
top-ups...
question, forgive me, I'm terribly sorry, but I asked a specific question.
Yeah, I appreciate...
I understand the debit card question because it's been made twice now. If it moved to a paper-based scheme, would you offer a top-up?
I do have a different comment to make in relation to the debit card. So because it's a debit card, we can't control, for example, what customers are buying with that card, and we have concerns around topping that up for customers and it not being used on the categories that government has intended.
Would you be able to
be
control it
for.
if it was a paper voucher?
Yes.
And if it was a paper voucher, would you then match Sainsbury's and offer £2 on top? Or £1 even?
We would need to consider that because it would obviously require investment, and we need to consider it across other areas like price investment, but it's certainly something we would consider.
You would consider it, thank you. What about your position, Aldi?
Aldi does accept Healthy Start vouchers, and we'd be open to adding value at the till. We would need to understand how we'd be able to make that work, and we've been talking with the NHS team recently on this.
Is it genuinely worth us going back to the government and saying, if you don't insist on it being on a credit card, but you make it paper-based, the supermarkets will look at topping it up? Just yes, no, or maybe. Yes, no, or maybe.
Can I give a context? I think you don't necessarily need to go back to the coupon. I think what we need to do is unlock how we can allow the private sector to top up the existing system. That would be the solution, and I would very much support that.
You would put extra money in.
Yeah.
maybe we would need to understand how it would work in our
Fair enough.
systems.
To Nilani's point, there may be a better solution, but we would want to be able to control the categories that money was being used for, so not to worsen health inequalities, but we would consider it.
I think we've all got a role to play in making sure that the number of people who access Healthy Start increases.
Sorry, I appreciate that, but that's a general comment. Would you look at if it was made more accessible?
Continue to support the scheme and would look absolutely as we're already doing.
Thank you very
with
much.
industry.
So we've got this whole problem, as you can see, I'm focusing on one aspect of affordability, but how can we make healthy food more accessible? What are you doing to make your basic ranges more accessible, both in terms of where they're sold and the price that they're offered at? Maybe we could start with Aldi.
Yes, of course. Excuse me. So our approach at Aldi is to have everyday low prices across our range, and because we're a limited line retailer, we only have a certain number of products, certain number of lines. So our mission and our ambition is to increase the healthiness of our entire range, which is why we introduced our Live Healthy logo.
Same price?
Yes. So that going back to the example I gave earlier with our full fat yogurt next to a lower fat yogurt in the same case on the shelf in the same price, and that would be the same across all of our stores as well.
I'm not quite clear about how it works. I mean, I've got here. I went on the website, Tesco's website, and I looked at the chicken masala. So you've got your basic chicken masala here, and you've got your finest chicken masala here. There's £1 difference in price. The cheapest, the basic is £3.85. The finest is £4.85, and the cheaper one has slightly less chicken, only 18% versus 20% chicken, but it has fully refined soybean oil in it. It has palm oil, and it has masses more HFSs. It has far more salt, for example. I mean, both of them fail quite badly when it comes to salt and sugar, but you have more salt in the cheaper one. Just take me as a nutritionist point of view. If putting all these things in, why did it make the product so much cheaper?
Well, if I can just be clear, I'm not a nutritionist, so I wouldn't be able to and wouldn't want to answer that.
I'm the nutritionist because it's a general question.
But I can certainly talk about reformulation and the work that we've done on reformulation. You pull out one particular example there. You know, what I would say, if you look across all of our ready meals, is that over half of our ready meals contain at least one of your 5 a day, and 30% contain beans, for example. So what we are constantly doing, obviously bearing in mind cost of living and needs of customers, is reformulating so that we have a range of products in a store, from the finest range that you just mentioned through
your finest range,
available for
your finest range here, and it's the finest, is it, and you have your RAG rating. And it's high, it's red for fat, it's red for saturates, it's red for salt. It's even worse with your basic rating. It's high in fat, it's high in saturates, it's medium in sugars, and it's high in salt. Can somebody explain to me why we need palm oil and so much salt in products to bring the price down? Can a nutritionist explain that to me? Which one of you is a nutritionist? I think one of you is a nutritionist.
So we're a nutritionist.
Two of us nutritionists. Why is so much? When you add salt and palm oil to food, why does it enable you to bring the price down?
I couldn't talk about the specifics of that particular product.
But it's all over products. I mean, if you read Christopher von Talleken's book, it's very clear about the range of products it's all added to.
I think the important point here is, what are we doing to help make the outcome healthier, driving healthier sales easier? So we're constantly looking at products. We have a number of brand standards for our own brand range. We're very strict about that, and we continue to benchmark products against our competitors. We put the labelling on front of pack to make it easier to identify the healthier choice, and we consistently benchmark products to reformulate over time. I think one thing about mandatory reporting is that if we were to start to do that by category, we would actually be more easily able to compare products across our peers, and I think that in itself would drive positive reformulation.
Okay, good. I just need to move, because the frustration of the committee, when we're all here, we all have lots of questions, and it's nice of you because we don't drive as deeply as we might otherwise do, but I'm going to need to move on to something which is about advertising. Does the advertising of food and drink products increase the consumption of what is advertised? Yes or no? Do you know, if you advertise something more, do people buy it more? I mean, you spend huge amounts on advertising. Presumably there's a purpose in doing so.
Must be yes, isn't it?
Yes or no?
Why are
Why
you
the
guys
silence?
struggling
Why
to answer
uncertain?
this question? I mean, it's self-evident, isn't it?
Why the silence?
We'll take Aldi, Asda first. If you advertise food and drink products, particular products, does it increase their consumption?
I don't have data on that, so I
You
can't.
don't
I
have
can't
data
share
on that.
numbers with you.
So
I'm
you're in your
sure
mind,
I'll-
as an expert of many years in the industry, you're not clear in your own mind whether it does or not.
What I can share with you is that for our own brand communications, as in across all channels and the way that we talk to customers, health is factored into that decision making.
Your own brand communications. Is that the same for all of you? Because you're all moving.
That wasn't the question. Sorry to cut it, but that really wasn't the question that was asked.
Sure. Go for it.
But that wasn't the question that was asked. I suppose, all of you supermarkets, you do advertise products on TV, online. Are you saying you've got no evidence, formally or informally, that what you spend large amounts of money on TV time, on physical media, you've got no evidence that does or doesn't promote the uptake of those products?
Could I just give an example of a campaign that we launched last February, which is our Everything campaign, and that is absolutely focused on great, affordable, healthy food
Yes, that still
in
wasn't
a family setting.
apologies, but that still wasn't the question.
I'm sorry, I was just going to come to that. And what we found actually is that has been really successsul. So that is a brand campaign for Tesco, absolutely focused on the basics of kind of good nutrition in a family setting. And if I could, kind of give an example of we think the impact that has had, our fresh food category over Christmas was our star performer, up 6.6% year on year.
I think Ben needs to come back, but I just said that wasn't the question.
No,
It's
that's
quite
fine.
ludicrous.
Okay, wait,
That's
one
fine.
second. Can I
Can I
just
come
one
in?
second? Can I clarify? When you guys in your roles, are you able to get that kind of data for us? When you're saying I don't have the data, does that mean you specifically don't have the data, or is it that Asda, Tesco, Sainsbury, Aldi don't have the data? Can I just get a clarification on that? Beth, you were the one who said I don't have the data.
I don't have that data with me today.
With you today?
I'd be happy to go and
right
look
to
at
us with
what
it.
data we hold. I don't know if we have the specific data you're looking for.
Okay, fine.
I think
Okay.
one of the complexities and the reasons why it's kind of difficult to answer this question, not all advertising is related to specific products. There's advertising about our brand, our shopping experience, our price. So, I'd like to take it away and maybe get a bit more clarity on the question.
That's fine. That's
We've got
so
minus
you've,
2
you've,
minutes.
You've said this. I think it's quite an important question. You've said that you've talked about your own products, but the control on branded products is less than on your own products, and you're all, with the possible exception of Aldi, from the research that we've done, I understand, moving towards a very intensive retail media push. And there's a talk of Tesco making as much as 10% of its profits by promoting whatever brands pay you to promote them in store, online, and through your cards and all that. If a brand pays you to promote you, you're not going to be worrying about whether it's nutritional or not. You're just going to take the largest amount of money that they pay you, and you're going to promote the brand. That's the case, isn't it? Maybe I take that to Sainsbury's.
I think for us to be successful, for us to grow as a UK business, we have to do what's right for the customer. And what the customer actually wants is for us to invest in making great quality products at good prices. So actually, promotional decisions are actually based on being
You
able
have a
to deliver
financial
value.
incentive to take whichever brand pays you most, regardless of its nutritional content.
It's not only that is considered when we consider what to promote. It's also got to be what's right for our customers and what's right,
We need to move
therefore,
on now.
for our business.
So, last question then. The less healthy advertising regulations came into force. There was a statutory instrument laid to exempt brand advertising from the legislation. Did any of your companies lobby against these regulations or in favour of the new statutory instrument? And does the trade association of which you're members, that's the British Retail Consortium, if you didn't, did they lobby against the regulations or in favour of the new statutory instrument? Oonagh?
So we weren't involved directly in those conversations, but I do understand that the trade bodies were involved simply to understand the guidance, that was needed, and to ensure that the regulations would be able to be implemented well.
Do you understand the guidance? Beth?
Yeah, from our perspective, we have always tried to engage with government in terms of policies coming in to ensure they're right for our customers. Again, are they going to drive costs,
Did you lobby on
etc.?
this? Did you lobby on the Let's Have Healthy Advertising regulations or the statutory instrument?
We spoke to government many times over a long period of
On this issue?
time. I don't have specific
On this
data
issue?
on that. Any engagement that we have with government has,
Did you speak to the government on this issue?
has the intention of
Speak to the government on this issue. Sorry,
we did speak to government
Thank you
on
very
the
much.
issue.
What about
but
Aldi?
Can I please clarify
Yeah.
the nature of those conversations? Yeah. The nature of those conversations was to understand, get clarity on the guidance, which it's a really complicated piece of legislation, and I think everybody who's engaged in that would feed that back.
Just to get clarity there.
To ensure we're implementing it in the correct way for our customers, and that is the nature
Did you try and
of our
make
engagement.
did you make a case to exempt brand advertising to
I'm
the
not aware
government?
of us making a case
What about
to do
Aldi?
that.
We've never lobbied against that
We've never
legislation. We've only ever sought for clarity for implementation.
Okay, and Sainsbury?
We welcomed the advertising regulations. We asked questions about implementation because it wasn't clear how, for example, recipes would be treated.
Did the British Retail Consortium, which you're a member of, lobby against the regulations?
I believe that they actually sought clarity for...
Okay. Just to let you know, we have, through a Freedom of Information request, we have a letter from the British Retail Consortium and others lobbying against these this regulation, and it's surprising that none of you seem to be aware of this.
Okay, which, thank you very much. Now it's mentioned, we need to move on. Thank you. Alex McIntyre.
Yes, thank you. And for your PR teams all get a little bit of a headache this morning. It's going to go on to price promotion and the idea of healthy foods and how they fit into that. I mean, without wanting to go across the whole panel, can we all broadly agree that you'd say non-HFSS foods are broadly seen as healthy by all of your supermarkets? So the foods that are not high in fat, salt and sugar, they would class as healthy probably for most of your purposes when you're looking at internal data?
Our sales-weighted healthy metric is based on the nutrient profiling model.
So I have just been doing a little bit of online shopping. Obviously, Aldi don't do online, but we will come to you in a moment. Tesco's 4 for 3 on your favourite frozen products on your offers of the week. They are Bird's Eye chicken dippers, Aunt Bessie's golden Yorkshires and Bird's Eye's potato waffles. Sainsbury's top offers of the week are Maryland cookies, fruity hot cross buns, Bird's Eye chicken dippers again, and we've then got a big vat of sunflower oil. Asda, we've got 12 mini chocolate pancakes from Warburton's, Fridge Raiders, McCain home chips, cheddars, and I think we've also got some minstrels and some M&Ms and some more potato waffles. And Aldi, on top of your amazing sales, obviously you don't do online shopping in the same way as others, but we've got wine of the week and beer offers alongside budget recipes. Now, I'm using those as an example. Non-HFSS foods, I've got a 2-year-old, and I'm very terrified of making sure that he doesn't end up looking like his dad, being morbidly obese with type 2 diabetes. And as I understand it, and according to all of you about healthy food modelling, I could give him a diet of Cocoa Pops for breakfast, followed by chicken dippers and potato waffles for lunch, followed by fish fingers and chips for dinner. And all of that could be promoted by you as offering price promotions on healthy non-HFSS foods. Do you see any issues with that? And maybe I'll start with Nilani.
We know that the nutrient profiling model isn't perfect. And in fact, it's actually why we use a slightly different benchmark to measure our healthy sales. There are quite a number of ready meals that would pass that model, and you've kind of described a few examples of that. I think fundamentally what has been helpful with the nutrient profiling model, so I do want to just stress that, is that it has led to quite a lot of reformulation across products trying to become non-HFSS, and that should be seen as a positive thing. Could we go further? Absolutely.
I mean, we mentioned reformulation. I think you mentioned it earlier. It's great that we're bringing out sugar, but what are we replacing it with? And I think, all of the science in this area suggests that people need to be eating more whole foods, more healthy, need to be eating more fruit and vegetables because the fibre in there is better. We need to be eating more, the basics of food rather than, I think Chris Van Tillerken put it, kind of manufactured edible products. Are we not concerned that all of these price promotions are totally within, and that's not to criticise, you're all acting within the law here, but do you not see that there's an issue here when we're basically saying that you can say hand on heart you're promoting healthy food here, Oonagh, by saying you can have 4 for 3 on Yorkshire puddings, chicken dippers, and potato waffles, and all of those products I buy and I enjoy and my son enjoys. But do we not see that that's going to have a problematic effect on feeding our kids that?
Well, we would say really strongly that we have price promotions and consistent pricing across every category at Tesco. So, frozen you've just mentioned, but in our fresh produce range, for example, we have always on promotions that we know are really popular with customers, but also, really successful in terms of customers accessing the fruit and veg that they need, as you've just talked about.
But that's on the front page of yours. But that's on the front page of when you go onto groceries and you go onto your offers, we've got Valentine's Day, we've got Weetabix, and then we've got 4 for 3 on chicken dippers, potato waffle. I can't see on the front page. There is a bit of for salmon, but quite a lot of my constituents, a 4-pack of boneless salmon fillets is beyond them, quite honestly, at the moment in the cost of living crisis. There's nothing on the homepage here apart from. No, I can't, there's nothing here that says here is a 3 for 2 on fruit and veg. Are we not promoting the wrong products?
No, what I would please, as I said, we are absolutely committed to offering great value across all of our ranges, including and particularly now with big focus on those healthy lines, and produce is a really important part of that.
Shouldn't that be on the homepage?
But it will be absolutely within all of our communication. So if I can use an example of just communication that you would have got, for example, if you were a club card holder, that absolutely for January was focused completely on Fresh 5 and on making sure that customers understood that Tesco had great value on the fruit and veg that they needed kind of day in day out for them and their families.
Moving on to Asda, to be fair on Asda, Beth, we've got potatoes and we've got apples here on your rollback page when you come onto the when you click through. But that's still, do you not see that there's a problem with all of these products being front and centre when we are trying to stop our kids? One of the highest obesity rates in children in the world.
Firstly, thank you for raising it on behalf of your constituents, because affordability of health is key. I think to bring it back to the definition of health, so you spoke to ultra processing, and you've heard from us around our metrics. Ours specifically is based on the NPM. From a nutrition science perspective, and I know this is getting into the weeds a bit, but that is my discipline. I've trained in that, and ultra processing is a growing concern with our customers. There are books written about it. There are challenges with the science around ultra processed foods, and the government scientific advisory committee on nutrition, easy to say, has kind of pointed out some of those challenges in terms of the nature of the data, the lack of definition. So we are committed to the NPM, because at the moment...
One of the challenges on the science, as I understand it, is quite a lot of the studies that have been done that say that ultra-processing isn't a problem have been funded by the food industry. Isn't that correct?
I don't agree with that assessment. I'm not close to the topic, and I'd be happy to kind of follow up on that afterwards. I think what we know from a nutrition science perspective is that the perceived harm, obesity, related disease, etc., related to food, is related to the nutrient content of that food. And Nesta, for example, have done some analysis to look at ultra-processing versus HFSS or NPM scoring, and they find that there's a huge overlap between those two definitions. So for us, we feel the credible science and the basis of our strategy is supported by the NPM, and that's the right direction for our business. In terms of the promotions that you referenced, thank you for correcting the record, because I think from our perspective, we've been involved with our commercial teams, and we know that there's a balance of healthy and less healthy products within that promotional activity that you've called out on our website, and we work closely with our teams to ensure that balance exists and that customers are able to access products across the basket, and they've fed back to us that they want choice. They don't want us to tell them what to eat. When we're looking at ranges for customers who are...
I'm just going to move you on to someone. Liz, I appreciate, Rowdy, you don't do online shopping, so it's not, it is a bit of an unfair example, but I guess the two of the top three are beer and wine, which I think is a little bit problematic, but for a whole different reason. I guess looking at price reduction promotions, I've called out the fact that chicken dippers are non-HFSS, which is quite a worrying trend. But even when you look at the very low bar that's set for HFSS, that's still accounted for 43% of all price reduction promotions, according to the Food Foundation's Broken Plate report. In terms of we're trying to promote healthy eating here, how concerned should we be by that figure?
We recognise that there is increasing concerns over UPF. We recognise that there's increasing concerns around the obesity crisis. At Aldi, we don't actively promote, certainly, unhealthy products to under 16s, and we don't have those promotions or those buy one get one frees or those gimmicks in our stores. What we focus on are the positive promotions that you'll see as soon as you walk through the store. So referring back to my point about making it as easy as possible for customers to make the healthy choice. At the end of the day, you're absolutely right. There is a balance of leading consumers and enabling them to have choice and us leading them in those decisions. We don't want to take that choice away from our customers, but we want to make that healthy choice as easy as possible for them, which is why we remove the noise of having those promotions on those unhealthy products.
Yeah. I was going to come back to a point that you made, Beth, about people not wanting to be kind of told what they're doing by their supermarket. Now, and again, sorry, Liz, this doesn't really apply to Aldi, you don't gather the same consumer data that the other three competitors do. You have more data about what we eat and drink than anybody else probably in the country, and our preferences and what we buy and when we buy it, and what's in our baskets. While you say your consumers don't want you to be nudging them in the right direction, do you not think that there is any moral responsibility on the supermarkets not to be encouraging more healthier choices by, rather than, I'm very conscious, and my basket isn't always very healthy. I think I was in the top 1% for a certain brand of bread rolls last year, and when I got my club card year in. Sorry, other good supermarkets are all very good supermarkets. I have shopped in all of you in the last year, but I do get my delivery. So we're all guilty of it. But the fact is, if you're doing price promotions and then getting how much of that is personalised to what people are already buying, and is that not then perpetuating unhealthy habits? And what could the supermarkets be doing more to step in there and actually, if they identify people who are constantly buying litres of ice cream, that actually they might, there might be healthy alternatives out there. Maybe we'll start with you, Nilani.
There's a few points I think to make on that. It's a great point, really, really valid. I think we're learning a lot about personalisation and the role of health within that, and still lots more to test and understand. So offers are based on a mixture of what you already buy, what we think you might like, and rewards to incentivise you. I talked about the fruit and veg challenge and how we have been using that to try and incentivise and reward customers for putting more fruit and veg in their basket. We've also done some other tests. So to give you an example, if you shop on groceries online, you go to a product page at the bottom, it might say customers who bought this also liked. And we tried overlaying health within that to try and show you slightly healthier choices versus what you might normally buy. We found that is showing some promise in nudging customers towards a better choice, but that requires us to have a definition that's a bit less binary and less black and white. Customers want to know what's a little bit better for me than what I was already having, rather than just the healthiest choice. I will say another example, though, that was quite interesting is with Nectar pricing. We ran a trial with 1.2 million customers in the test, 1.2 million customers in the control. The test only received healthy offers. The control received the current mix of healthy and less healthy offers. Whilst the healthy offers in the test group appealed to the top 8th most healthy customers, we also saw customers essentially step away, redeem them a lot less. So there is an important balance to strike, and I don't know what the answer is to that, but I think it was a good understanding of, okay, it isn't just about promoting the healthy things.
If I could come to you next.
We couldn't probably overstate how important personalisation is. As Nilani said, we are all learning. It is moving really fast, but within personalisation, things like gamification of nudges are increasingly important, we believe, in helping customers choose healthier. And a good example of that actually is, the 5 a day campaign that I mentioned. We introduced 5 a day nudges into our app when we launched that campaign, and that was the most successful challenge, Club Card challenge at that time. So much so that we will now obviously repeat that and learn from that and roll it out to more and more customers.
Yeah, just to clarify the point on customer choice. So customers I'm not talking about nudging in that sense. I'm talking about removal of choice, and they're not supportive of that. So just to clarify that point, in terms of nudging, obviously Asda Rewards, we do have a loyalty scheme, but our premise is that customers don't have to be signed up to a loyalty scheme to access Asda value. So we don't require that for customers to engage with our promotional strategy. That being said, we're definitely looking at nudges, and there's still data we can use outside of a loyalty scheme to understand how we do that. So we have looked at basket segmentation. So we've looked at the NPM scores of our customers' baskets, and then we're able to look at trends in different areas. So our least healthy customers, what are they doing in our stores? Which categories are they purchasing or over purchasing versus other groups? What are their demographics, etc. And that's enabling us to identify the right initiatives to nudge behaviour. And I think we are really engaging with our supply base in terms of that project to look at nudging, and it's certainly something that we're focused on. And we found some really interesting insights. 50% of our customers' baskets are healthier, at the healthy end of the scale, 50% are less healthy, but there's opportunities across the piece. And I think to Nilani's point on NPM, you can use the binary cutoff of healthy, less healthy. We also use the numeric score so that in categories that are generally healthy, so say bread, white bread and brown bread would both be classed as healthy under the NPM, but white bread has a score of -1, brown bread has a score of -5. So we still look at opportunities even in healthier areas to nudge behaviour change. So yeah.
All right, I'll hand back to the chair.
Very much, Andrew. George.
Thank you. Following that brilliant line of questioning, I have to say, on behalf of my colleague, may I ask about in the area of ensuring that consumers have reliability in the information that they're given, and that they're able to make informed choices as they walk around the supermarket shelves. I mean, do you agree that consumers should be as well informed as possible so that they can make accurate and informed choices? You're all nodding. Okay. So I mean, have you undertaken any studies, or have you got any information which demonstrates that consumers are confident in the information that they have available, they trust in the labelling that they are provided with, and that they can make those informed choices? Do any of you have kind of evidence to demonstrate that customers are confident that they are able? I'm talking about processed foods, obviously not fresh food now, but on the process in terms of the labels and the promotions and the way that they are presented to them, that customers are confident in that. Anyone have any evidence where you've investigated that? Lilani?
Sure. We don't have specific research on the question you're asking, but what I can say is I haven't seen evidence that customers don't trust the information that's on the front of pack. Right. What we see, though, is that customers, so when we've done customer research, they'll tell us their main concern with trying to prepare healthy food is that it is, they're often shopping around the store with cognitive overload. Primarily that they've got lots of different tabs open in their head at the same time. They're thinking about all the other tasks they've got to do, and by the time they get to preparing their dinner, they've got decision fatigue. So we tend to see them prepare the same meals that they've always prepared. They have a very narrow meal repertoire. So the challenge is actually that converting healthy food into tasty, affordable food takes effort. And that's where they would like help and inspiration. I haven't necessarily seen specific questions on trusting the data that they're given.
No, okay. I mean, Professor Van Telken, indicated to us that that a lot of the processed foods, are designed to encourage, excessive eating. It's not just a question of providing healthy options. It's actually designed in a manner to actually encourage excessive consumption as well. I mean, do any of the rest of you undertaken any kind of studies which give you an insight into consumers' confidence in the labelling that you present to them and the information you provide?
I could probably talk to
Go on,
that
Una.
in that,
Yeah.
you know, we understand very much actually that customers are looking for information on the products that they're buying, and that things like front of pack labelling is incredibly important.
Yes.
We use for our own brand the kind of traffic light model, and that we know is really well understood and appreciated by customers. So when they can easily go round a store or online, they can see, you know, at a glance, the benefits or otherwise of the products, obviously, that they're buying from us. Increasingly, you know, to your comment about ultra processed food, we know customers are also increasingly looking at the back of the pack ingredients, and therefore for us, you know, what's really important is that when we can, wherever we can, we provide as much information as possible about the products that they're buying, so that they can make that choice when they are buying.
But isn't it reasonable to say that a customer, in order to make an informed choice, would need a lot of time, a magnifying glass, a calculator, probably a desk to put products on, have someone to look after their children for a couple of hours, and probably a postgraduate degree in nutrition in order to properly make those kind of choices and to make those kind of comparative analyses of all of the labels that you provide?
We're really clear actually for our own brand products, particularly which obviously we have control over. Our front of pack labelling is really clear and simple, because to your point, we know how busy customers' lives are, and there isn't the opportunity for them to kind of digest it all, so we need to make it as easy as possible to give them the information.
Can anything more be done to ensure that consumers have reliable labelling which a lay person can understand and have confidence in? I mean, do you believe that it's the best, you know, where we are at the moment is the best it can ever get, or do you think that more can be done? Yes, go on then, Liz, yes.
There's always more that can be done, and whilst we don't have that specific insight as to how much they trust the labels that are on pack, we know that our ambition is to build that trust with the customer. Mm-hmm. So yes, we have traffic light labelling, yes, we have placement in store, which is important, but this is one reason why we developed our Live Healthy logo, to make that choice as easy as possible, and that is backed by very specific health criteria, and every single product that has that logo on it must also have a health claim. So it's to make that choice quicker and easier for the customer, and our ambition is to put that across as many products as possible.
Yes. Just coming on to the issue of meal deals. I mean, you're all promoting meal deals, I think, in all of your stores. You're not, no, in Aldi, sorry. So this is not aimed at you, Liz, I apologise. I mean, Bite Back have raised concerns about the healthiness of meal deals, and I mean, do you accept that meal deals themselves actually contribute to overconsumption? Very often those meal deals, and certainly the information available on the choices which people make, indicate that they are going well over the calorie, you know, the advised calorie levels for a meal during the day. And are you doing anything in particular to encourage the healthier choices within those meal deals themselves? And Nilani.
Sure. Actually, there's a lot of choice of healthy options within the meal deal today. Let me give you just some examples. You can choose sandwiches, salads, poke bowls, make your own salad. Within snacks, there's a lot more choice than you might perhaps realise. Everything from cooked chicken and boiled eggs to prepped fruit, pieces of fruit, carrot sticks and hummus, yogurts. There's also waters and quite large bottle of water, juices, smoothies, etc. Yeah. Just to give you some examples of what that would look like in terms of calories, if you were to choose a tuna sandwich, the tuna and sweet corn sandwich, some prepped watermelon and a bottle of water, it's about 380 calories, I think.
Right. Well, if you were, but
sure.
But on average, people don't, and that's
actually there's a lot of healthy choices within there. So I think it's really important that we're offering that choice for a fixed price, and it gives you the option of having a balanced meal. We're also trying to attract the customer from the high street. So this is about a lunchtime mission, and where calories can often be a lot higher than if they were to make those choices in store.
Oonagh, can I ask you that from a health perspective, are you concerned about the most popular meal deal drink amongst club card holders being Red Bull?
Well, I mean, if I could just go back to your question about kind of overconsumption of meal deal,
Well,
absolutely.
I mean, that question first, though.
Well, yeah, Red Bull is a popular choice, but it's one of over 300 drink choices within a meal deal, and our role clearly is to offer choice. Going back to what Nilani has just said on the healthiness of meal deals, what we know at the moment is that within Tesco, over 82% of our meal deal mains are healthy, and within the drinks category, it's 81%. But in addition to that, you talked about the work that we're doing to offer customers more and more choice. Really, excitingly, I think, from a health perspective, the most popular side now within a Tesco meal deal is actually boiled eggs. So for the last 2 years, we've sold 22 million British eggs as a result of meal deal. And actually, in addition to that, it's not just about protein, 34 million fruit pots. So what we are saying is we're offering choice, but what's really exciting actually for this committee, I hope, is that customers are increasingly making those healthy choices.
Sounds like you all need to speak to Bite Back about this.
We speak to Bite Back quite a lot, actually.
Okay, right.
I've got a very quick supplementary, particularly for those who have the data at individual customer level, so not aldi, but do you measure, maybe I'll start with Beth, do you measure the sort of healthy basket score of every individual consumer as they come in? Do you have that figure?
From our perspective, we don't have loyalty card data, but where we can join customer data through other measures, we can look at the healthiness of the basket.
So do you have that data? So sort of per
we
customer,
do have that
per
data,
shop?
but as I said, our focus has been absolutely on category MPM and looking at the offer that we have.
And Nilani, do you have that data?
I'd have to check. We report, as with everyone else, on total.
Have you ever considered sharing that data with the individuals?
We do actually give data playback through Nectar on how, for example, how much fruit and veg you've bought over the year.
Over the year, but not per shop?
Not per shop and not on average. It is something we have discussed, but I think a customer would need to opt in to receive that. They would want to have to watch.
So it's actively been discussed. Is it in train, or is it just like a pie in the sky?
I probably can't talk about that here, but happy to submit
I would be really grateful for that. My point being that you've got this data. You've got more data on me than I think I've got on myself, probably, between you. So I'm just curious to understand if there was any, sort of, to help consumers make better choices. If you've got that data, is it possible that we get it? Beth, have you ever had that discussion?
Presumably there'd be data privacy, security elements. I'm not sure. When I see that data, I don't see any specific customer data. I just see a basket, for example, so I wouldn't be able to link that back to a customer. But yeah, we can look into that.
Okay, and Tesco, have you ever considered
I think what we would say is there are many different ways that we can support customers to lead healthier lives, and providing them with information and support, we talked about on front of pack, is really important.
So this is not something you've considered?
Well, I think what we continually look at is what we can do to accelerate change.
No, but I just want to, yes or no, have you considered this point?
Well, it isn't my area of remit in the business, so I'd have to find that out. But what I would say is we are doing everything we can to pull the levers that are available to us to help customers if that's what they want from us, from their health.
So whose area of the business is it to give that data
It's just
back?
within our customer marketing team, but obviously we can look at that if needed.
Okay, I'll move on. Greg Stafford.
Thank you very much, and apologies for being late. I'd like to note that, of course, when I went to my Sainsbury's in Water Lane in Farnham, they told me that the most bought item by my constituents there was the humble red pepper. So someone is doing something right, I think. I want to ask questions about consumer choice. Now, you can either take the slightly catastrophizing view that Professor Van Tulliken took when he was before this committee and said that the supermarkets are, and I quote, feeding our children to death. Or you can take the view that you as supermarkets are responding to what consumers want and providing that. Where do you sit on the spectrum between how much that what you provide is you trying to influence customers to buy things as compared to customers telling you what they want to buy? Don't mind who goes first. Let's just start this way.
Yeah, for a change, because Nilani's been starting. So from our perspective, we're really clear that we've all got a role to play, actually, to help customers lead healthier lives. Customers themselves, as you talked about, communications channels, retailers, manufacturers, campaigning organisations, etc. We all have a role to play.
Can I just interrupt? I mean, someone mentioned Red Bull earlier. If your customers want to buy a Red Bull, do you see it as your responsibility to tell them not to?
I think it's really important that we offer choice. absolutely offer choice, you know, and we would always, as you might expect from Tesco, aim to be really helpful with what we do. So you know, we provide the information on front of pack, but you know, also every information they need at the point of purchase to help them make the decision that's right for them.
Yeah, so aligned to the points around consumer choice, so we definitely wouldn't want any removal of choice for customers, but we do feel there's a role for us as an industry to play in nudging those healthier choices. You weren't here earlier, but we have a healthy sales metric. We're looking to drive that out to 2030. I think one of the things we know as a business is we understand how customers shop. To your point, we are looking at this data and we can see through our basket health segmentation, for example, where the opportunities might be. And it's not clear cut. There's certain categories that overplay in certain basket segmentation, for example. So we're really keen that any policy decisions or policy advice is around an outcome-based metric that we can then drive with that understanding of our customers and where the biggest opportunities are to drive change.
Thank you. Yes.
Aldi is driven by ensuring that access to healthy, affordable food isn't privileged, that it's available to everybody. And I would absolutely support that we don't want to take that choice away from our customers. That said, our customers have told us that they want us to make that healthy choice as easy as possible for them. So whilst that choice is there in the store, we use our price and our placement within our stores to help them make that choice. So that's the way that you'll see that every store you walk into will be laid out the same way. Our prices will be consistent and they will be at the lowest possible price.
Thank you.
So I think we have an important role to play. We shouldn't underplay that. In making the healthy choice affordable, incentivising it, reformulating product and signposting customers to that better choice. However, if I give you an example of a trial we did where we edited choice, we ran it in the north of England in convenience stores in the biscuits aisle. We removed chocolate biscuits because they exceeded the sugar level for Public Health England's sugar reduction targets. What we found is customers shopped elsewhere. So although calories consumed from the biscuits aisle reduced, calories purchased elsewhere went up in the cakes and seasonal aisle, showing that you need a system-wide approach. So editing choice in one area will simply mean the customer looks for that elsewhere. So any approach has to be system-wide.
Really interesting if you've got shareable data on that.
Yes,
that would be
yeah,
really
it's
interesting to see. Obviously, given all of your roles, it gives a symbol, at least, if not a practical, but at least a symbol, that supermarkets seem to be taking this issue seriously. Going back to the sort of consumer-led or supermarket-led around the healthier choices specifically, how do you get feedback from customers about whether you are meeting their healthy demands, healthier needs, and how do you ensure that, and when you see the balance again with this section between the nudge and the response from customers? And we go the other way down the line.
Well, we do regular testing, test and learns, and we also do quite regular customer insights. So, as I mentioned earlier, some of the things that customers are really struggling with is the effort involved in preparing a healthy meal at the end of the day. So that's actually where we're trying to focus, because we know we can address price, and we are doing that. We're trying to make the healthier choice more affordable. We're trying to signpost to customers to that. We're trying to incentivise that choice more often, and we've had quite an extensive programme of reformulating that.
We would have our customer insights regularly. In terms of the actual data is limited, but I guess the big driver would be footfall through the stores.
Yeah.
That is what is determining to us of whether the decisions that we're making are the right ones. And when we did relay out our stores and put produce at the front of the store, that was a positive decision. Obviously the customers appreciated that, it made the right decision, and it drove more customers into our stores, which is why we continue to work on that basis of make that decision easy for our customers, and the lack of confusion, the lack of noise is what attracts them to an Aldi store to enable them to do that shop. So that would be my answer, is how we drive customers into our stores.
Thank you. Beth?
In terms of how we know we're supporting customers with health, we can see it in our data. So if we look at our top selling products, so the products that customers are putting into their baskets week in, week out, the vast majority of the top selling products are healthy, so fruits, vegetables, milk, and so we feel we're doing a good job in making those products accessible, because by definition they're being purchased by our customers. In terms of low demographics. Again, earlier we touched on Asda's customer, so we disproportionately serve lower socioeconomic groups, and price is something we're really passionate about, including within health. And our Just Essentials range, which is effectively our opening price point range for customers with lower budgets, is disproportionately healthy, so we've made sure the majority of the SKUs in that range are healthy, and they're accessible in terms of trading in stores, but also we've really focused on key components of Eat Well, so whole grains, oily fish, for example, produce. We've ensured that those key staples are available within our most affordable ranges. So I feel confident to say that health is accessible at Asda, and it's something that we really care about.
Well, I mean, just to summarise really for us at Tesco, there's two things that we know are important to customers at the moment and absolutely front of mind day in, day out. One is cost of living, which won't be a surprise, but the second one, which may be more of a surprise, is health. The health of them and their families. So everything we're doing is focused on making sure that we address both of those areas. Within health, we know 82% of our customers want our help when it comes to health, and we know that through constantly talking to them and getting insight from them, but also kind of addressing their needs, and there are positive health trends which we're all, obviously looking at and serving customers on, for example, protein, fibre, beans, etc. All really good campaigns that we are driving, but based very much on customer feedback.
Thank you. And just very briefly, we had the example of, I felt it personally, the lack of chocolate biscuits. Were there any other campaigns that the other stores have run that perversely or conversely haven't worked, like the example of the chocolate biscuits? Have any of you done trials where it hasn't worked or consumer behaviour has not changed in the way you thought it would?
We touched on a few examples earlier.
Apologies.
I suppose a point on accessibility. So obviously, when we talk to customers, price is kind of cited as the key barrier to healthier choices. During our 2-year partnership with Nestle, we ran a trial looking at accessibility of fruit and veg, so offering customers effectively free money to spend within produce. And one of the sort of challenging insights that we found was that a very small proportion of those vouchers were actually redeemed, which suggests to us there are barriers outside of price that might need to be addressed when it comes to key healthy categories like fruit and veg. And I think that's where, you've heard from us all today, particularly from Asda, we really care about health and we know we've got a role to play. I think there are broader systems changes needed, education, inequalities, cooking facilities, and because even when we're offering customers free access to that category, redemption rates are around 25% of that offer. So yeah, it wasn't necessarily unsuccessful, but it didn't have the desired effect.
Given that you've discussed it before, I won't ask you. A final question, just if anyone objects to this statement, please say it. Is what I'm getting from you that the key thing from your consumers, whether you're talking about the general food buying or specifically health food buying, the key thing for your customers is choice? Does anyone disagree with that?
Price is really key.
Price and choice.
Yeah.
And health.
And health.
They disagree.
Yes.
So you don't agree with that statement, then, is what's...
I think our role is to offer choice, and what we're learning at the moment is that for our customers, cost of living is having a huge impact. Therefore, we all have to offer great competitive value in our stores, and increasingly health is also front of mind.
Within choice must come health. I know my colleagues over there don't like this line of questioning, but I think it's very presumably within choice you're talking about healthy products as well.
Yes.
Thank you very much, Gemma.
Thank you. Following on from that, I wonder, we've been seeing some news outlets report that some supermarkets have been changing reformulations and even aisles as a response to the weight loss jabs and that trend. I just wondered, is that something that you guys have been seeing in your consumer insights? Is it something that you're actively looking to change as well? That's the next phase of this inquiry, where we'll be looking at some of these and weight loss management. I just wonder if consumers are asking for those changes and how you are responding to them. Can I start with Liz? Is that something you're considering?
In response specifically to that, not specifically, no, we aren't responding to that specifically. That said, our approach is to build trust in our customers that they can have a highly nutritious shop when they come into Aldi. So it builds into our existing strategy of positive reformulation, of removing negative nutrients, adding in positive nutrients, and making identification of those healthy products as easy as possible through logos like Live Healthy. So I think it would build
Not
in...
specifically, but as part
but
of a
it
wider
builds into...
conversation.
It would be a fundamental part of our strategy, of our existing strategy.
Thank you. Nilani?
Yeah, so I would say we know that this is a really emerging area. There's quite a high usage of customers trying the drugs. So yes, it is something that we are discussing the impact of. Unfortunately, there's very limited data on actually how customers purchase today, and we need better data to inform action. We have developed a range of products that would be suitable to customers who may be taking those medications. The Small But Mighty range has launched, if you wanted to have a look at that in store. It's a calorie-controlled range with very specific nutrition criteria for fibre and protein. I will also say that, consistent with what Liz said, our strategy is to grow fresh food and to act where customers want us to, which is to bring affordability to the key elements that make up your fresh food and your meals every day, and that's where we're investing. And so I think the direction of travel is supportive of that strategy.
Yeah, so with regards to consumer trends around health, they do change over time, and sort of two key emerging trends are GLP-1 and protein, and we'll always look to develop the right products to support customers. I think what's important is that what we develop is science-based and evidence-based. So we're committed to, for example, on GLP-1, we commissioned a literature review through British Nutrition Foundation to understand what are the challenges that those customers face, what are the key nutrients of concern, so like iron, for example, and protein. And we have developed some healthier products in January, and we've taken some of those key nutritional science recommendations and ensured that those products are suitable. But I do think those products are generally suitable anyway. They're just healthy products, smaller portion sizes with nutrient classifications like high protein. So yes, we'll respond to customer needs, and it's something we're seeing growing.
I'd support what our colleagues have said.
Thank you. Danny Beals.
Thank you very much. I'm going to ask a series of questions on the food promotion and placement regulations, particularly in store. Beth, earlier in your previous answers, you suggested that the regulations had, I think you used the word minimal effect based on the data you'd seen. What was that data? What was that minimal effect?
Yes, so in reference to high fat, salt and sugar regulations, which is the kind of big change that's happened from a health perspective over the past few years, we have found that the legislation, just by its nature in terms of the product classification, the categories in scope, out of scope, etc., complex and also costly to implement. So,
was the challenge of implementation, but you said it had minimal effect.
Yeah, sorry, coming on to that. In terms of the effect in the analysis, I think it's a really important point for policymakers, and evaluation needs to be considered for any forward-looking.
What was the effect that you saw?
So because we hadn't had any kind of central evaluation of that policy, a number of retailers collaborated to share data with the university. So we were one of the retailers who did that. There's others on this panel. We shared data with Leeds University, and they independently
the data sorry to cut across, because the data we've seen, so researchers from the Nutrition and Lifestyles Analytics team at University of Leeds suggested to us in the data that we've seen that the changes led to the equivalent of 2 million fewer in scope HFSS products sold per day across England. So that would be 730 million less HFSS products sold. So do you feel that's a minimal effect, or is there different data that you've seen?
Same study. I think the data and the reference point that I'm looking at is it's a 0.63% reduction. So it's a less than 1% reduction in sales of those less healthy products. When we've run trials, and we're currently analysing the trials that we've done with Asda, and we will be publishing the results of those, but we do see more significant change when we implement health initiatives, 10%, 20%, and even 60% in some of the initiatives we've done in driving healthier sales in small product categories and areas, but less than 1%.
So just for comparison, you're saying this is 730 million less products is minimal and 2%, but you've got ideas that would drive a 60% change. So, I mean, that would be transformational
In certain trials that we've run and in certain categories, we've seen by looking at health and focusing on health in our commercial strategy, we've been able to drive really significant change.
Why don't you do that? If you have policies that are far more effectual in driving that sort of change than this policy, which has been introduced, why don't you just do that? I mean, that would remove the problems we're talking about today.
Yeah, we absolutely are doing that. So we're working with our product teams, with our commercial teams and marketing to drive those changes.
But we're certainly not seeing that in the data, are we, in terms of the level of shift in consumer behaviour?
We've reported an improvement in our healthy sales metric year on year, and it's something that we're continuing to focus on. The target's out to 2030, and there'll be much more activity to come from us. But to reassure you, it's something we are very focused on.
Does anyone else, have you noticed any impacts from these regulations? Is there anything particularly you want to add? You don't have to, but anything particularly you want to add around data or impacts?
I mean, I could probably talk about one of the things that has been really positive about the HFSS location regulations, and that's to do with the sheer amount of reformulation, particularly with our suppliers, that came about on the back of that. Yeah. So if you think of the space in any store, but you're thinking of a Tesco store, our suppliers, we know, do want to be on those kind of premium sites, those end-of-aisle sites, so obviously the sites that were influenced by the regulations. And as a result, there was a huge amount of reformulation that took place following, the implementation of the policy, which we saw as a really positive thing.
Do you have any data around the kind of level of reformulation?
Well, I mean, as you talked about with the University of Leeds study, we actually see that as a really good thing, that, all change is good, and everything that we can all do through every lever to drive anything forward has got to be considered as a good thing.
Just because time, I'll move on. Yes or no, are you confident that your stores are fully compliant with the regulations? Maybe just go around quickly, yes or no? Just yes or no. There's other questions to come.
We try very hard to put the systems in place to allow us to inform where we range things.
I don't want to be rude, but the question is yes or no. Are you fully... You can not answer if you feel uncomfortable, but...
We try as far as possible.
Okay.
We have a robust system. Can I tell you that there's absolute clarity across every 1,000 stores that we have in the UK? Somebody may have made a mistake. That's why I can't answer you with a definite yes or no, but we have a very robust system to manage our merchandising.
Same as what these guys have said.
We're confident, and if there's any issues, we would always take action immediately.
Okay. In terms of the systems in place, which is why I just wanted yes or no, to ensure compliance, what do they look like in terms of your systems? Maybe, I don't know if one or two want to answer this question.
I can come in there, that's no problem. Excuse me. We have a centralised controlled merchandising process. So all of our merchandising plans are managed centrally. They are then distributed to the stores, and they're expected to follow those exactly. We also have checks within our stores on anything, they're called FSDU products, so freestanding display units. They obviously can be placed more easily around the store. We have limitations as to where they can be placed, and we check the scores on those. We also ask for the HFSS scores from our suppliers so that we are able to understand where we can merchandise products, and we've also trained our store colleagues on the legislation.
How often do those sorts of checks take place of stores from kind of regional management or central management?
That would vary across the store. They obviously do have them regular visits, that then they would be checking all sorts of things like that in terms of accuracy to merchandising plans.
Regular would
pricing.
those visits be? What's regular?
Our store managers are in there every day.
I find it strange, that sounds quite... Every day this issue is being checked, so why are you not confident? No one can say, yes, we're confident that the regulations are being followed. So, I mean, everyday check...
I'm very confident that regulation is being followed. I guess I just want to be specific in my answer that we have 1,000 stores across the UK and mistakes can happen.
Yeah, okay. Just because of time, I'll move on. So it's been suggested to us that there's been ways of operating to perhaps get around the regulation. So perhaps the letter of the law might be being followed, but the spirit not. So, for instance, new promotional central sections of aisles, more digital advertising screens, for instance. Do any of you recognise this kind of suggested problem? Have you kind of moved promotional sections to the middle of aisles rather than at the end, for instance?
So it hasn't happened with Aldi because, as I say, we don't have those buy one get one free offers.
But in terms of the other supermarkets?
In terms of compliance to the law, so letter of the law, to all the points made earlier, significant investment in data, controls, audits, colleague training that happens on a regular basis in stores, home offices, all relevant colleagues. We also, our legal and compliance team also audit our stores to look at compliance, and then they feed back any challenges.
No, I accept that might be compliant with the current legislation, which is the question.
Yes.
Is it compliant with the spirit? So has your practice changed? And as supermarkets, do you now have more promotional central sections of aisles that you would have had at the end of aisle previously?
Need more clarity on the question. I'm not sure.
So the question is, so promotional aisles, sections which are advertised, which are, use the same colourful branding, yellow branding, whatever your chosen method is, that would have been end of aisle previously. Now that is restricted. Have you moved that to central aisles? Are there more of those sections now than prior to the legislation changing? That is the question.
Have to get more data on that. From our perspective, the spirit of the law and what we're trying to drive in terms of healthy sales is our 2030 target, and we're driving improvements in that.
Do you follow up on that data then if you're unable to answer that question? The other suggestion has been that there's some loopholes in terms of types of goods. So unpackaged baked goods are not included. Party food products are not included. There's a number of things that are exempt, and they're now increasingly being promoted at checkouts and aisle ends. Has there been any change in terms of the increasing promotion of those sorts of exempt goods?
Can't comment on whether there are more promotions in those areas, but what I can say is that we actually submitted concerns about the loopholes in our consultation response. Let me just give you a few examples of them. You're absolutely right that unpackaged foods are exempt, smaller stores are exempt, takeaway establishments, your Pret, your Greggs, etc., also exempt. And we think that it needs to be a level playing field, so we did ask for that.
Do you think those loopholes should be closed?
Yes.
Would you be happy to share data with those sorts of products and the level of promotion on end of aisle and at checkouts? Is that something you could take away to share with us, whether there's been an increase in? Thank you so much. That's very helpful. In terms of potentially the broader future changes to regulations and also the updating of the nutrient profile, the nutrient profile model, do you have any views about the application of a kind of updated NPM through these regulations? Whether that be a good thing, bad thing, concerns about it?
We do have a concern about the new NPM model. There's two concerns. A secondary concern, I would say, is the increased reporting that in its current state that will deliver for us. That will increase investment in that area, which will take time and investment away from where we can where we know wins work. So, for example, investing in price simplicity, placement in the stores, etc. The primary concern, though, I would say more importantly, is the confusion that it could offer to customers. So the new model as it stands would make products that can absolutely be included in a balanced healthy diet, such as yogurts and cereals, they would then be classed as unhealthy, and we don't want to bring that confusion to our customers. What we are, though, is absolutely open to working with government to understand how best to use it to have a simple building on existing data from cost efficiency perspective to ensure that we are able to have a single reporting mechanism that gives choice to the customer, which we've discussed today is really important, but doesn't narrow the ranging that we can do in stores.
Yeah, I think I'll hand over because I'm slightly over time.
Sorry, we've run out of time. Thank you. Jen Craft.
Thank you, Chair, and thank you for coming today. I just want to turn towards sort of healthy sales targets, and I might pick up a bit on what my colleague Danny was just focusing on there. Many of you have already sort of implemented kind of healthy sales targets. Just to begin with, is there anything that the government could learn from your experiences when they're designing their new policy of the healthy food standards, and where are the risks and the opportunities as you see them? So anyone who wants to dive in first.
I could start with that if that's helpful, Jen. When you were out of the room, I talked about the fact that we have set a healthy sales target back in 2021, and we've actually achieved that. 65% at the end of December just gone, which we're really proud about. And as you can imagine, a huge amount of learning through that process, particularly around what it takes to report accurate data, and for that accurate data to be understood well by suppliers, by obviously our own organisation, our commercial teams, etc., but also obviously within industry. So, we're really pleased and proud actually to, share that information if that's helpful as we move forward.
Thank you. And Beth, I think you said previously that Asda was seeing year-on-year reports of healthier food sort of targets being met. Do you have that data to hand, or are you able to write to us and share that?
It's publicly available. It's published in our ESG report.
Okay, fantastic. And I'd just like to pick up on a couple of maybe slightly more niche things. So you said smaller stores are exempt from sort of government legislation around product placement and various other policies aimed at it. But obviously, a number of you do have smaller stores that fall into that footprint. Have you taken action in your smaller stores to promote healthy food? And I'm very aware that for some areas that would perhaps be classed almost as food deserts, a Tesco Express or an Asda, I think, don't know what the small version of Asda is called, apologies, or like a small Sainsbury's is the only option people have. So is there an effort to improve the kind of healthy offering in those stores?
To our experience on that. So our Express estate is relatively new, so it's a new expansion of our business, and I think for us the really important thing about that is, we're widely recognised for having the lowest price grocery basket by the grocer, etc. So for us that is about bringing Asda value to more communities. I think where we have smaller stores, there are challenges around ranging. And for example, fruit and vegetables, particularly in petrol forecourt style formats, we find that the food waste and the sustainability challenges around food waste outweigh customer demand. And I think it's really complicated. It depends on the type of store. Is it residential? Is it on a motorway somewhere? But it's definitely something that we're cognizant of. And a proportion of those stores are in scope of HFSS legislation based on the square footage.
Are you proactively looking to so I'll give you a really good example. In my patch we have Tilbury. I think there is an LT being planned to be built there. But for most people, their access to fruit and vegetable shopping is the Tesco, like little Tesco Metro, that's Tesco Express, that's there that's in the heart of the community. But residents have told me that their offering in terms of fruit and veg is really, really low, and they've been doing some work locally there's got a very high level of childhood obesity in that community, with parents actually understanding nutrient labelling on the front of foods, and they say they haven't got an alternative because they can go into the small Tesco and they can buy some really heavily processed pre-packaged foods, but they can't buy an apple. So if we're looking at trying to make things healthy through the food that is available, is there work that you're currently doing to improve that healthy offering, not just in the big box stores, but in the smaller ones that might be more relevant to communities?
Absolutely. And you've mentioned Tesco, so I guess I should take that question. We are absolutely committed. Wherever you shop at Tesco, across the whole of the UK, you will have access to healthy and sustainable food. And a really good example of that, actually, you mentioned Tesco Express, is our fresh offer, which we have in our large stores. Fresh 5 is always available in our smaller stores, the Express stores, but that's Fresh 3 actually, just because they're smaller stores. And that is a fortnightly, always on promotion on the fresh fruit and veg that we know customers need for their everyday occasions. So as you've just mentioned, apples, pears, bananas, oranges, tomatoes, etc. So you will go into any Tesco store and you should be able to obviously access what you need for good, nutritious food for your family.
You did say earlier there is a leaning in favour of foods that are longer life, because of course the demand might perhaps not be there for fresher food regularly. Is there a lean towards that in these smaller stores?
I mean, we're committed to make sure that there is the range that customers need in their locality for them to be able to cook the food that they want to cook for their families. So that includes absolute fresh, and we've made a lot of investment recently in our fresh offer.
I would hope to see it change, because I would reflect that at the moment in some of our like more poor areas in my constituency, that's not necessarily the case, and that's what I've had reported back to me. I'd just like to very briefly pick up on, Liz, what you were saying about the nutrient profile model and the concerns around that. And you mentioned it's to do with having choice and giving people consumer choice as well as accurate information. Are you confident at the moment that people have that accurate information when they're doing their weekly shop, that they know that what they're purchasing, for example, for their children? So some of the concerns that you flagged are around breakfast cereals or food for children, where they could be fall into a unhealthy category, although they have some health benefits. Are you confident at the moment that although foods might not be what we want to give our child on a daily basis, parents aren't presented with that as their main choice in supermarkets?
Certainly from Aldi's perspective, I would agree that we are not actively promoting unhealthy products to under 16s, and we are actively ensuring that we are making the healthy option available. I would also be confident that we're giving that information to customers to have that choice, and that is through our labelling policy. So be it through traffic light labelling, which all of us engage with, our cartoon policy to ensure that unhealthy products aren't attractive to children, etc. So our mission is to make that choice easier and clear.
Okay. So would you not support a nutrient profiling model that makes that really crystal clear as to where, I know we knock off some, I keep coming back to the example of Cocoa Pops, and my colleagues know that I seem to have a vendetta against this particular breakfast cereal, but there are several health claims on that packet around fibre, around protein, but the kind of level of sugar and the content of, sugar content in that cereal means it's not something that you should be giving your child every morning for breakfast. Now, currently, there are parents who will be struggling to find something to give to their child, and they will see this packet, and it will have lots of green labels that say things that sound like really good things you want to give your child. They won't have necessarily a traffic light system on the front, and so they will think this is okay. My question is a nutrient profiling model that makes it clearer that there are high levels of fat, sugar, salt within a product, regardless of whether it might be good for like protein or fibre or, goodness knows what else you might name. Is that not better? Is that not a better way to proceed, to make it clear so parents have informed choice?
Yes, Aldi would support a model that demonstrates that. The concerns we have over the 2018 model are that does bring in confusion for the customer. So that's what we would want to work through with industry and with regulators to ensure that we're absolutely delivering the outcome that you're talking about there, and not limiting that opportunity.
And does anyone else have anything on that?
Our main concern with the new model is data and the challenges around particularly free sugars. It can't be analysed, it can't be objectively determined. I know we've received some new comms yesterday from government, and we haven't had a chance to digest those yet, but currently, based on what we know about the model, free sugars is particularly challenging. And to your point earlier around the value chain and all of the upskilling and data investment that's gone into the 2004 model, we foresee big challenges and long time frames to introduce that new model. So, yeah, a bit more guidance and support required, I think.
But you would broadly support something that makes it clear and doesn't allow health claims to kind of overawe around fat, salt, sugar.
To reassure you on own label, for example, we have strict criteria, so a product has to be healthy to hold a health claim. The only exception to that is where we're trying to indicate a healthier choice. So if you look at cheese and reduced fat cheese, they're both unhealthy as determined by the NPM, but we still want to talk to customers about that better choice. So a nutrition claim in that context is helpful for customers, but all of those decisions come through our nutrition team, and we've got strong kind of policies for suppliers in that space.
Thank you, and I'll hand back to the chair.
Very much, Joe Robertson.
Thank you. The government's 10-year health plan talks about introducing smarter regulation focused on outcomes. What do you think that means? I mean, that's in the 10-year health plan. From your perspective, what do you think smarter regulation focused on outcomes is about?
What I would want it to mean.
Your perspective,
Yeah. what I would want it to mean is that we have a single source of truth, that brings in mandatory reporting that is in a cost-effective and clear manner, and that can be used across the entire industry so that we can level that playing field. And when you look at the outcome-orientated element of that, because we've leveled that playing field, it drives more voluntary efforts, but also improves reformulation and access to affordable food across the entire market.
So what's not level about the playing field at the moment?
As we were exploring earlier today, the fact that we have different mechanisms, different measures, there isn't a easy comparison across all of the supermarkets, which is what mandatory reporting would deliver.
If I could add to that, there are quite a number of exceptions to the current regulations. The soft drinks industry levy and its extension to milk-based drinks will only apply to pre-packed drinks. So the majority of milk-based drinks served in an out-of-home sector, so take your Costa or your local coffee shop, would be completely exempt. Equally, the placement regulations do not apply to that same sector. So there's actually quite a number of areas where there are exemptions. Similarly, for products in and out of scope, not all HFSS products are captured by the placement and advertising regulations.
You talked about sort of voluntary reporting, but do you see regulation going further than voluntary reporting? Because voluntary seems to sort of go against the idea of regulation. I mean, regulation is mandatory. But I think you were talking, Liz Fox, about mandatory voluntary reporting. I just wonder whether you can be slightly clearer about that. Because if it's merely reporting, then clearly there is nothing requiring you to change behaviour rather than explain what's going on in your stores.
But mandatory publicly reporting would offer transparency across the market, which would then drive competitor behaviour to improve versus their benchmark or versus their competitors.
Yeah, anyone else?
The only point to add, I agree with Nilani and Liz's points around transparency, having access to data across all sectors of food and not just retail, and giving that accountability across the food sector. The other point which I referenced earlier is around that outcomes-based measure, so government to set and policymakers to set the North Star and what you want us to deliver, but don't be prescriptive in terms of the way that we do that, because our customers are different, our stores are different, our operations are different, and we feel that we're best placed to make the decisions about driving healthier sales.
Would you accept the principle of some sort of penalties or sanctions for failing to meet targets?
Our number one priority with customers is price. I touched on it earlier again, but our lowest income customers have a shortfall of £73 after their essentials are paid for, and they are the customers that we are advocates for. So any incentive that would drive cost into our business and therefore potential cost price increases across our ranges is not something we'd be supportive of. Similarly, CIDL was referenced earlier, and I know there's been reference to food taxation around certain nutrients, for example, and our concern there is there aren't technical solutions to reformulate other categories. Drinks are, without discrediting the suppliers in that space, but quite simplistic drinks to reformulate or products to reformulate. You can't do that in other areas because of regulatory challenges around use of sweeteners, but also because the technical solutions just aren't there in some categories, in which case the cost of those products would increase on the back of any levy. So in principle, no, and voluntary progress should be invited, and then mandatory measures should be considered if progress isn't made.
Yeah, I'm struggling to see where the mandatory part to any of this would be from your perspective, and it sounds like cost trumps everything, including health.
I'm happy to clarify from a mandatory perspective. So for us, a good mandatory reporting policy looks like consistent measures, good guidance, agreed positions, because the NPM is, even the current NPM is challenging in terms of categories that are sold by millilitres instead of grams. There's lots of challenging areas of that calculation. So I think the mandatory measure would bring everybody up to the same standard, and we all know we're reporting on the same thing. And then from there, we can determine the right voluntary metrics to deliver change.
Do you think this information is going to affect the average consumer when they walk into your shop and are faced by promotions?
The reporting, yes. we've already set a voluntary healthy sales metric, so we are driving that change anyway over the next 4 years. But to everybody's point earlier, mandatory reporting would ensure that we are definitely all reporting on the same thing and we can compare progress across businesses.
Can I just ask you something, and it's very much linked. So earlier you were talking about, so anything that's driving cost into food you wouldn't be for. You mentioned already that the 2004 model cost money to implement.
Yes.
And took a long time. Do you have a figure for how much it cost you?
I don't have that figure. What I can say is it involved data collection, so systems changes to allow us to incorporate that data. We've also, through third parties, started to ingest branded data because, of course, our portfolio is both branded and own label. Development to our own brand systems to automate NPM calculations, and then changes to merchandising systems, processes, etc. that have been talked to. So I don't have a specific figure.
When you say you don't, you as an individual don't, or the business doesn't?
I'm not sure.
Please, could you go and find out? The reason I'm asking is if you're going, as these discussions progress, and as you know, the government's looking at this, if one of the reasons that certain things cannot happen is because they're going to drive price into food, and this is one of the arguments you're going to use, we then need to understand, as a point of profitability, actually, how much is this costing you? So, you've got a £5 billion pound revenue that is coming into the business. Can we just better understand when you say it's going to drive cost into something, what that actually means as a proportion? Because when we're talking big figures, it all sounds like a lot. We're trying to understand in the context of the business. If you don't have those figures, that's absolutely fine. Please write to us, no problem. But it would be really helpful to get some of those figures. Have you got those figures?
Can I just quickly say, Chair? So the point you made before was that was a high cost to the business, but you've now said you don't have those figures. So is that point just pure speculation on your part then?
No. Effort and cost has definitely been spent. I just don't have that data. What I would like to clarify on the NPM, my concern with regards to data and investment on the NPM is free sugars is not an objectively determinable figure. We can't analyse it. Our supply base doesn't hold it, and that is my concern. Is how do we build up to that data when it's effectively a theory? So I think we can share more information on our concerns, but that is our primary.
Do you understand the point my colleague's making here? You can't, on the one hand, say that the implementation of this is going to be prohibitive and it's going to start driving up prices, and then not give us a figure as to how much it actually cost the last time around. So
it was in relation to penalties in the discussion.
It was about
penalties.
I think you were talking about the 2004 model.
You said you'd invested a great deal of time and money.
Yeah,
and I take your point. You don't have the figure for it. But to say that the cost of that would be prohibitive in looking at updating that model, I mean, that model is 2 years old now. And actually, I think, don't get me wrong, it could be that you've invested a lot, but it would be very interesting for the committee to know, out of the proportion of the £5 billion in Asda revenue last year, how much that costs. And actually then, as a health committee, we've then got to look at the health of the cost of the health of this country, because we're spending £17 billion a year on obesity. And at the moment, you're saying that actually it's costing us too much to tackle the obesity crisis. And I take that's not the point. We're trying to understand the balance there.
Yeah,
and I don't think it's fair to say it's costing us a lot, but then to say, actually, I don't have that data in front of me.
To clarify my concerns on the model, the primary concern is the data, and we think the lack of accuracy with free sugars determination. Investment is a secondary concern. On the point regarding revenue, yes, we are a large business. Our revenues are big numbers. It doesn't necessarily reflect profitability, and also we have other challenges. We've got sustainability policy, EPR, national insurance, business rates. We have a lot of challenges that our business is facing into.
We're trying to put it all in its context. We understand that these things are complex, hence why we spend 2.5 hours discussing them. So I suppose my very final question is, we've got government actively looking at this. We've also got a report that we're trying to shift the dial. Leave us with one thought each. You only get one. If someone else says yours, take it as read and move on. Liz, you get to go first. What's the last thought you'd like to leave with us?
I'd like us to ensure that we make things as simple as possible for customers and consumers. Confusion is the key. So to do that, we need to be able to implement a simple process so that we can keep that decision simple for the customer.
Thank you. Oonagh?
Please move forward with mandatory reporting. We can't overstate how important that is, particularly if it's implemented across the whole of the food sector.
Lovely. Simplicity, mandatory reporting. Beth?
My final thought would be, I hope I've come across that we really do care about our customers, and this is a primary focus for us. In terms of future policy and legislation, the food environment absolutely has a role to play, and we're driving that forward. My ask as a nutrition scientist and with my background is that all areas that were identified across the Foresight report 20 years ago around obesity are looked at, because without systematic and systemic change, the food environment is one important lever, but it's not the only problem that our customers are facing when it comes to health.
Thank you. And Nilani?
I agree we should regulate to level the playing field across the whole of the food system. I'm going to make one additional ask, which is, as a person of colour sitting here in front of you, I think one of the biggest things you could do is collect health data by ethnicity as well.
Yes.
Because we know that there are strong links between ethnicity and health outcomes, and if we looked at that, we would use that data to inform policy prevention and policy outcomes that could be very different by ethnicity.
Thank you very much. Right, you are, I'm sure, happy to know we have reached the end of this session. Thank you so much. We are grateful for your time and your insights. Thank you. Order, order.
Thank you.
Thank you. And we're out. Well done, everyone. Thank you very much. That was useful. MPs, if you have any time to watch this, it would be helpful to watch